input on the input.
Morning to all of you.
കേൾക്കുന്നുണ്ടോ പറയുന്നത്? Good morning. Our program will begin shortly. Please stay tuned.
All the dignitary guests joined in us on this platform. We are going to commence the seminar shortly. All of you are welcome to this event. Please stay tuned with us.
Good morning to all of you. The 57th National Ayurveda Seminar, organized by Ayurvedishala Kottakkal, is about to commence here. For the kind attention of everyone at the venue, we request you to strictly adhere to COVID protocol, please. For those who are physically present here, kindly switch off your mobile phones, please. The theme for this year's seminar is Post-COVID Syndrome. Following the will and vision of our founder, Vaidyaratnam P.S. Warrior, Ayurvedishala always remain open and receptive to knowledge from all sources for the cause of progress and prosperity of Ayurveda. This prompts us to give due priority to conduct academic sessions for discussion on topics with contemporary relevance. Ayurvedishala has been organizing national Ayurveda seminars since 1964 with objectives to bring out the strong points of Ayurveda in the best interest of the society and of the science as well. We believe that our initiatives involving the participation of clinicians, academicians, scholars, and others associated with Ayurveda industry would contribute in its own humble ways to the timely upgradation and progress of the science.
For the past 15 years, our seminars were conducted at different parts of Kerala with a view to reach out to the fellow physicians and our well-wishers scattered across the state. This year, the situation being very different, it is decided to merge the National Ayurveda Seminar with our Founders' Day celebrations today on 30th January, the day which has a place in the history of nation and Ayurvedashala as well. The event, which physically happens at Kottakkal, will be live streamed on Zoom, Facebook, and YouTube platforms. The seminar will have 4 scientific presentations. After each presentation, the session will be open for discussion on the topic concerned. Participants may please make use of the chat box facility to convey the questions to the resource person. And also those who are attending or viewing the seminar on Facebook and YouTube platforms, kindly put your comments on the comment box below the video. We shall be certainly addressing your queries. So may I invite the dignitaries present over here to please be seated on the stage. Dr. P.M. Warrior, sir, Chief Physician and Trust Board Member, Ayurvedishala. Dr. K. Muralidharan, sir, Additional Chief Physician and Trust Board Member, Ayurvedishala. Professor Dr. K. Murali, sir, Chief Editor, Publication Department, Ayurvedishala. Dr. T. M. Unikrishnan, sir, Chief Medical Officer, Ernakulam Branch, Ayurvedishala. Sirs, please.
Thank you, sirs. Paying homage to our founder, Vaidyaratnam P.S. Warrior, and paying respect to our present managing trustee, Dr. P.K. Warrior sir, who is the leading light behind our all endeavors, we shall move on to the seminar now. Prayer.
ഊർണോഷ്ണീഷാവതംസം മൃദുധവളപടീവാരവാണോത്തരീയം രൂപ്യോദ്യത്വേത്രദണ്ഡസ്ഫടികമയപിധാനാവൃതാമീലിതാക്ഷം കാലേ കാലേ കരാംഭോരുഹമുകുളസമാരാധ്യ ധന്വന്തരിം തം ധ്യായാമ്യാചാര്യവർയം ഹൃദി ലളിതകലാകോവിദം വൈദ്യരത്നം.
May I request our Chief Physician, Dr. P.M. Warrior sir, for the welcome address.
Good morning to all of you. Paying homage to our founder, Vaidyaratnam P.S. Warrior, may I gladly invite everyone to step into this virtual event, the 57th National Ayurveda Seminar of Ayurveda, based on the theme Post-COVID-19 Syndrome. Our allegiance to enrich and upgrade Ayurveda remain ever with the same flair and fervor as imbibed from the will and vision of our founder, Vaidyaratnam P.S. Warrior. Every year, the 30th January comes to us with the remembrance and reinforcement in rededicating ourselves to the commitments in taking Ayurveda to glorious heights. In fact, we all know that academic-oriented deliberations do have phase-changing roles in such endeavors, which would bring forth more value additions to the foundational and application level knowledge base of the science. Ayurveda has been keen to organize annual seminars every year since 1964 with the same view and purpose. We believe that our efforts in this have been useful and meaningful with respect to strengthening the theoretical, therapeutic, and research wings of Ayurveda as envisaged by our founder. We also make it a point to keep the platform open and welcome to the up-to-date information from the stream of modern medicine too, as it would pave way for us to translate the classical wisdom of Ayurveda in terms of a parlance with contemporary relevance and global acceptance. This year's National Ayurveda Seminar stands a little different for this mode of conduct and organization, as we still remain in the reel of getting released from the clutches of COVID-19 pandemic slowly. It is in this background that post-COVID syndrome is selected as the theme of this event. I'm glad to announce that a panel of physicians with ample efficiency, expertise, and experience to broaden our insights on the subject assembled on this stage today. It is my privilege to welcome Dr. Aravind, Head of the Department of Infectious Diseases, Government Medical College, Thiruvananthapuram, to this event. Dr. Aravind completed his graduation from Government Medical College, Alappuzha, and MD in Internal Medicine from the Government Medical College, Kottayam, and is serving now as HOD, the Department of Infectious Diseases at Government Medical College, Thiruvananthapuram, since 2011. He is an honorary consultant of infectious diseases at SCT IMST, member of Kerala State Rapid Response Team, and plays key roles in many other prominent medical boards and committees of the state. A good number of scientific publications to various international journals account to his credit. Dr. Aravind Ayurvedashala is proud and happy to have you here. A very warm welcome to you to this event. Dr. Rajagopala, Associate Professor and Head Department of Kaumara Bhartiya, All India Institute of Ayurveda in New Delhi, is present with us. He did his post-graduation and PhD from Gujarat Ayurveda University, Jamnagar, and has a dynamic professional track record in the field of teaching, scientific writing, and research projects. He is also a representative of various technical and research committees at national and international level. I am honored to welcome Dr. Rajagopala to this event. Dr. E. Mukesh, Assistant Professor, Department of Roganidhana, BPSV Ayurveda College, is going to be another speaker of the day. BPSV Ayurveda College stands as a symbol of the academic brilliance and interest of our founder. I am sure that the soul and spirit of Vaidyaratnam can't be brighter when someone belonging to that branch of Ayurvedashala tree speaks here on this day. Welcome, Dr. Mukesh. I would like to welcome Dr. T.M. Unnikrishnan, Chief Medical Officer of our Ernakulam branch, formally to this event. Dr. K. Murali, Chief Editor of our Publication Department, Ayurvedashala, is the moderator of the day, and for the sake of formality, I welcome you to this session. Dr. K. Muralidharan, Additional Chief Physician, Ayurveda, will be
proposing the vote of thanks to this event. Welcome, Dr. Muralidharan. And
I offer a warm welcome to the participants of various endowments
and prizes to be
part of this.
presented and
Wholeheartedly
most importantly, the wholeheartedly
log on to
participants
this.
log on to this platform to attend these sessions.
Great
Great
things
things
happen when there is gathering of great minds. Once again, welcoming each and every one connected to this program by means of participation, coordination, and facilitation. Thank you, one and all.
Thank you, sir. May I humbly request Dr. Aravind, sir, Head of Department of Infectious Diseases, Government Medical College, Thiruvananthapuram, to give presentation on the topic, Ongoing COVID Syndrome, Current Perspective. Dr. Aravind has joined us online. Sir, please.
Good morning. Can you allow me to start my video? Good morning. I am extremely privileged to have been invited to this session at Ayurveda. I would like to thank.
Excuse me, sir.
Am I audible?
Sorry, sir. Would you please check that you are unmuted, Dr. Aravind, sir?
Actually, I am unmuted. Am I audible?
Yes, sir. Yes, sir. Please, sir.
Yeah. Good morning. It's my privilege to have been invited to the 57th annual conference organized by Ayurveda Kottakkal. I would like to thank PM Warrior sir as well as all the dignitaries on and off the dais. So as sir has mentioned, the topic of today's deliberation is this ongoing COVID syndromes or the post-COVID syndromes. I will start sharing my screen. Are the slides visible? Are the slides visible?
Yes, sir. Yes, sir.
Okay. As Warrior sir has clearly mentioned in the introductory address, we have been in the grip of this COVID-19 for the last 1 year or so. It was in 30th January 2020 that Kerala had its first case. After that, we had around say 9 lakh cases or more. Along with this COVID-19, the problems that the patients who apparently recover from the clutches of COVID-19 face in the next coming weeks or months are also a major concern to us. So initially it was described as the long COVID syndrome, and now really we are confused regarding the exact terminology. We know that initially the manifestations that patient had after apparent recovery used to be termed as the long COVID syndrome or the long overhaul syndrome, because majority of these patients took weeks or months to regain their normal activities. So this long COVID syndrome was something which was actually coined by the patients in WhatsApp groups and all. It was not a really scientific term, but then this terminology was the one which really depicted what these patients went through after getting discharged from the hospital or even after, say, mild infections. Then later the IDSA and WHO, etc., they coined the term post-COVID syndrome. Post-COVID syndrome means after apparent recovery, some of these patients were having multi-system manifestations which actually prevented them from having their normal lifestyle. So that was referred to as this post-COVID syndrome, but still the confusion remained. So post-COVID means that the COVID part is over, and what the patients are experiencing is something which is actually not directly related to this COVID syndrome. So for example, in Kerala, we do the antigen test negativity, and whatever is happening after that cannot be described as post-COVID syndrome. It could really be a manifestation of the ongoing inflammatory process. So post-COVID seemed like a misnomer. And recently, maybe around 2 weeks back, the terminology was changed by the NICE group in UK, and now the term ongoing COVID syndrome is used. Ongoing COVID syndrome means that even after weeks or months, whatever the patient is experiencing in the multiple systems are actually a manifestation of the ongoing dysregulated inflammatory response of the body to the initial hit by the virus. So scientifically, this ongoing COVID syndrome is actually more of a better terminology than this long COVID syndrome and the post-COVID syndrome. So to begin with, this post-acute COVID-19 is a multi-system disease, sometimes occurring even after a relatively mild acute illness. So this was actually defined as, so initially this post-acute COVID-19 was defined as manifestations extending beyond 3 weeks from the onset of first symptom. That is, any patient having persistent symptoms after 21 days from the first symptom was referred to as having this post-acute COVID-19, and around 10% of the patients were supposed to be having this, and anyone with symptomatology persisting more than 3 months from the initial symptom onset was supposed to be having chronic COVID-19, and around 2% of the patients were supposed to be having this chronic COVID-19. But then if you look at the different publications, some publications says that this percentage of patients having this post-acute COVID-19 may be as high as 70 to 80%. If you look at the studies coming from the UK as well as Italy. But then we need to understand one thing. Majority of these studies were done in hospitalized individuals, and in Italy, UK, and in the Western population, only those with hypoxemia were hospitalized. So depending on the population which is being studied, the percentage of those with this post-COVID syndrome may vary from, say, around 10 to 80%. If you're taking only those patients who are hospitalized or in the ICU, maybe majority of them definitely will have symptoms which persist for more than 3 weeks. When we look at the pathophysiology of post-COVID syndrome with its myriad multi-system manifestations, it is postulated to be due to a persistent low-level inflammation or relapsing inflammation due to dysregulated immune responses. So this chart from WHO is very, very important. That is the time taken by the patients to recover. We know that if 100 patients develop COVID-19, in Kerala, around 5% will have this severe disease, of which around 1.5% may require ICU care. So more the severe the illness, the more time it takes for the patient to become normal again. So if you look at this disease with mild severity, the time taken from the symptom onset for total recovery is around 2 weeks. But in the case of a severe disease, the time taken for normal recovery is around, say, 3 to 6 weeks. This clearly shows that if you put the definition of post-COVID syndrome as symptoms persisting for more than 21 days, the terminology may not be correct, because in severe disease, for all the symptoms to abate, it may take up to 6 weeks. So the terminology ongoing COVID syndrome is definitely more scientific than post-COVID syndrome. In the Kerala scenario, what is more important is that we do look at the antigen negativity for hospitalized patients to be discharged. So the problem here is that the antigen negativity is insisted not to convey the meaning that the patient has recovered. Antigen negativity does just means that the patient is not infectious. So even after the patient becomes antigen negative, the disease can progress. It is just like a hit and run mechanism. The initial 10 days or so, there is the stage of this viral replication, and then the immune dysregulation does occur and the patient can progress to cytokine storm. So even after the antigen is negative, the patients are likely to progress, a subset of patients. So this is actually the latest guideline from the NICE group. So they have actually defined this acute COVID-19 as signs and symptoms of COVID-19, which can persist up to 1 month. It's very important. Ongoing symptomatic COVID-19 is symptoms and signs persisting for 1 to 3 months after symptom onset. And post-COVID is actually defined as signs and symptoms that develop during or after an infection consistent with COVID-19 and which continues for more than 3 months and is not explained by an alternate diagnosis. So basically, acute COVID-19 is anything up to 1 month. Ongoing symptomatic COVID-19 is something which occurs between 1 and 3 months. And post-COVID is those symptoms which persist after 3 months. This is actually a very, very important aspect. So what about the pathophysiology of this post-COVID syndromes or the ongoing COVID syndromes? As we have discussed, it is just like a hit and run phenomena or the domino effect. The viral replication occurs during the first week or say up to 10 days, but then in a subset of individuals, especially those who develop this severe disease and all, there is a dysregulated immune response, what you term as the cytokine storm, which can affect multiple organ systems and which can lead to the myriad manifestations of the post-COVID syndrome. So this is something known as the domino effect or the hit and run phenomenon due to the initial viral insult and body's dysregulated response to the same. This does not occur in everyone. It actually occurs in those patients who are having risk factors for progression of the disease. So the reason for this post-COVID syndrome probably is going due to immune dysregulation, then activation of the coagulation cascade and intussusceptive endotheliitis or endotheliopathy. Now we need to know about the extrapulmonary complications of COVID-19 to understand or not in order to know what to look for in case of this post-COVID-19 or ongoing COVID syndrome. We know that the spike protein and the receptor binding domain is the one which attaches to the ACE2 receptor, which is usually present in the type 2 pneumocytes in the lung. And that is why, the lung has the maximum surface area, and that is why majority of the patients do develop this bronchopneumonia. But then we should know that this ACE2 receptor is also present in the endothelium, is present in the cardiac myocytes as well as the conduction system, is present in the pancreas, it is present in the proximal tubules in the kidney, it is present in the hepatobiliary system, and also present in the blood-brain barrier. So wherever this ACE2 is expressed, the virus or the spike protein can bind to this ACE2 receptor and get internalized and can lead to the multi-system manifestations. So as discussed, the patients means in the second week or third week actually can have this activation of the coagulation cascade, which can manifest as thromboembolism. The patient can present with DVT, pulmonary embolism, catheter-related thrombosis as well. The reason is because of this, the endotheliitis, because the endothelium has this ACE2 receptor along with this activation of the coagulation cascade. And when you look at the heart, we have heard about many patients after discharge from the hospital dying because of acute myocardial infarction, patients developing the stroke syndrome, etc. So, the ACE2 receptor is present in the cardiac myocytes, and the heart can be affected in these ways. You can have this involvement of the cardiac myocytes leading to the myocardial injury or myocarditis. The conduction system can be involved, leading to cardiac arrhythmias, cardiogenic shock. Some patients can develop this myocardial ischemia, and patients following this pulmonary embolism can have this acute pulmonary, etc. And when we look at the endocrine axis, we know the ACE2 receptor is present in the pancreatic beta cells, so there is an insulinopenia, and the patients can have, even those patients with euglycemia can have in the COVID-associated dysglycemia, and those with diabetes, the sugars can shoot up and can be a big problem. And one important aspect of treatment of acute COVID-19 infection is optimizing the glycemic status. And when we look at the skin, you have so many dermatological manifestations. Not only the rash, you can have this libido reticularis, this vesicles urticaria and pernio-like lesions. And then when we look at the neurological manifestations, we know that the virus can reach the brain, as well as the cytokines also can reach the brain, cross the blood-brain barrier, and can lead to the neurological manifestations, which can occur along with this COVID-19 or can occur as a part of this ongoing COVID syndromes. Patients can have this encephalitis or encephalopathy, Guillain-Barré syndrome, can have this anosmia, the stroke syndromes, etc. And the renal manifestations include the acute kidney injury and proteinuria. Hepatic manifestations include transaminitis, and the GI manifestations usually include this diarrhea. So we should have the bird's eye view about the distribution of the ACE2 receptor, so that when patient presents with these sort of symptoms, we'll be able to relate it to the COVID-19 infection. And this was the first study, which it was a telephone-based study, which looked at the lingering symptoms reported by participants who apparently had recovered from COVID-19. So these were the symptoms reported: fatigability, which was almost universal, cough, congestion or shortness of breath, loss of taste or smell, the headache, body aches, diarrhea, chest or abdominal pain, confusion. This was based on a telephonic interview. This was the first study to be published on the symptomatology of post-COVID-19. And then this is another study which is actually very, very important to us. So around 55% had fatigability even months after discharge from hospital. Around 42% had breathlessness, especially exertional breathlessness after discharge. 34% had this acute memory loss, something which is referred to as brain fading or brain fogging. All these things are reversible. 30% had this sleep disorder, very, very important. And the sleep disorder, the quality of sleep as well as the quantity of sleep was affected. And this is actually referred to as a new term was coined, that is COVID insomnia. And then impaired concentration was in around 28%. And this is a study which is ongoing in Trivandrum Medical College, because around 800 of our healthcare workers were infected with COVID-19. And you know that the patients who are likely to develop these post-COVID syndromes need not be the patients who are having severe disease. Definitely those with severe disease will have this organ involvement, and they are likely to take more time to return to normalcy. But those patients with mildly symptomatic infection, because majority of the healthcare workers do not have any comorbidities, even those with mildly symptomatic infections can have these debilitating symptoms which can persist for weeks or months. So this study is an ongoing study. It is from the post-COVID registry maintained in Trivandrum Medical College. Around 800 healthcare workers are included in this study. You can see that around 2% had depression, around 10% had anxiety, the brain fogging or brain fading, that is actually sort of a clouding of consciousness, or the thoughts are not really focused or oriented, in around 10%, multiple joint pains in 10%, headache in 15%, myalgia in 15%, excessive hair loss in 20%, altered sleep rhythm in 24%, the exertional breathlessness in 30%, and excessive fatigability in 60%. So majority of them are having excessive fatigability. And recently this Lancet paper published, the 6-month follow from a hospital in Wuhan. They looked at around 2,400 patients, and the observation was that even at 6 months of acute infection, the COVID-19 survivors were mainly troubled with fatigue or muscle weakness, the sleep difficulties, anxiety or depression. Patients who were more severely ill during their hospital stay had more severely impaired pulmonary diffusion capacities and abnormal chest imaging manifestations. So they actually divided the patients into 3 groups, that is those who never required oxygen, those who required supplemental oxygen, and those who required this in the support of the NIV or this mechanical ventilation. So definitely those patients who had severe disease took more time to return back to normalcy. So any of the following symptoms, that is weakness or fatigability, was present in around 86% of the patients even 6 months after recovery from hospital. This number actually appears to be pretty huge, but then we need to understand one thing. These patients were the hospitalized patients. So out of 100 patients, maybe around 10% may require hospitalization. So the rest 80% not fit into this study. So the rest 90% actually may not experience this post-COVID symptoms, but there is a subset amongst this 90% who can develop these non-specific symptoms like say myalgia or this brain fogging or fading, which may not be related to the disease severity. And in our study itself, one interesting observation we made was that those patients, especially the females, were the ones who are likely to experience more of these post-COVID symptoms. Definitely, we know that the males are the ones who are likely to develop severe disease. They are the ones who are likely to die when compared to the females, and they are the ones who may end up in the ICU. So when we look at that, they are the ones who are likely to develop this exertional dyspnea and all. But when we look at other symptoms like say brain fogging, fading, fatigability, polyarthralgia, myalgia, rash, and all those stuff, females are apparently having more of these problems than the males. And the explanation is supposed to be the generation of these autoantibodies against self-antigens. This is supposed to be the mechanism for the post-COVID symptoms. And we know that these autoimmune manifestations are more commonly seen in females. And this is actually when we look at the lung fibrosis and all. So around 56% of the patients did have some sort of a CT abnormality, especially this ground glass opacities, even 6 months after discharge from the hospital. So in short, the cardiovascular, this post-COVID syndrome or the ongoing COVID syndrome is a multi-system syndrome. So the manifestations which we usually experience in the cardiovascular system are patients can complain of palpitation, which could be due to this myocarditis, cardiomyopathy, or cardiac failure. So the respiratory system involvement could be in the form of lung fibrosis, pulmonary artery hypertension, and pulmonary embolism. The nervous system involvement could be in the form of anosmia. In some patients, this anosmia may take up to months to recover. Patients can present with stroke syndromes, short memory loss, reduced attention span, confusion, poor quality of sleep, cognitive impairment, and cognitive blunting, which is referred to as brain fogging. The mental health issues. So the neurological and the psychological aspect have been clubbed together, and the term a post-COVID neuropsychological post-COVID syndrome has been coined. The mental health issues, which include anxiety, depression, post-traumatic stress disorder, and the sleep disturbance, which has to be addressed. And the musculoskeletal involvement, like the polyarthralgia, polyarthritis, myalgia, excessive fatigability, and the most important one is the chronic fatigue syndrome. Because from majority of studies and from our experience, we have seen that this fatigue is a major problem. It may take months for patients to recover, and some patients can progress to the state known as chronic fatigue syndrome, where not only the physical exertion but the mental as well as emotional exertion can lead to participation. Now, another interesting aspect is that some patients do develop these symptoms. Now, it's about this anomia, which is due to the action of the sustained cells. Patients can develop this.
Please bear with us. There is some.
Sorry, I lost connection.
Sir.
Technical issue. I think I am back. Okay.
No problem, sir.
Are the slides visible now? Okay, okay. So some patients do have this chemostasis, that is, slides are not visible.
Not visible, sir.
Okay.
Still it is not visible, sir.
Okay, try to rectify.
Okay, sir.
Now.
No, sir, it is not visible yet.
Now, am I visible?
Your name is displayed on the screen, sir.
Now, is the slide visible now?
Yes, sir. Yes, sir. Now it is
okay.
all right.
So there is something known as the chemostasis. Chemostasis means actually the perception of chemical sensation by the taste buds. So usually in patients with COVID-19, only the nociceptors do get involved. That is, some patients may not be able to appreciate the the taste of this menthol or the chilies, etc. So all the taste sensation may not be affected. This is due to the selective involvement of the nociceptors. Also, we know that these AC2 receptors are present in the dorsal root ganglia, and some patients can present with the neuralgic pain. So identifying the nature of the pain in the as part of this COVID-19 is also important, because if the patient is having neuralgic pain or autonomic involvement like exertional tachycardia or hypotension, etc. So we need to think about this autonomic involvement also, which is explained by the presence of these AC2 receptors in the dorsal root ganglia. So basically, the UK NIHR has the broadly categorized the COVID symptomatology into 4 post-COVID syndromes. One is the classical post-critical illness syndrome, the classical post-viral fatigue syndrome, the lasting organ damage, and fluctuating symptoms with slow recovery. So classical post-critical illness syndrome is those who are in the ICU definitely may take the months to recover, just because of the critical illness, myopathy and neuropathy. Post-viral fatigue syndrome we have discussed. Then the lasting organ damage also means those patients with pneumonia, etc., can progress to fibrosis and all, and may take months to recover. And fluctuating symptoms is the one which is the interesting one. Patients may complain of this myalgia, arthralgia, etc., and after say some days they may complain of vascular headache like sort of thing. So this is in short how the lung is affected. In the beginning, you can see the red areas are the areas where this bronchopneumonia is there, and after weeks this will heal. But then you can see that even after 6 weeks of discharge, the entire lung has not become green. So the areas of red or areas of the lung involvement or pneumonia do persist, and that is why the patients do present with exertional dyspnea. And if we are familiar with this COVID-19 only for 1 year or so, but then we do have experience with a similar virus, that is SARS in 2003. So in studies in SARS show that even after say 2 years, a majority of the patients did have this exertional impairment, significant impairment of exertional capacity. And other studies show that 40% of the people after recovering from SARS still had chronic fatigue symptoms 3.5 years after being diagnosed. So the chronic fatigue is actually a very important component of SARS, MERS, and also in COVID-19 infection. And this is the postulated mechanism for why some patients go into this pulmonary fibrosis. We know that the AC2 receptor is the one to which this spike protein binds. So the AC2 receptor is sort of downregulated. That results in increase in the angiotensin II levels, which is not only a vasoconstrictive peptide, but can also drive up the pro-inflammatory cytokine release, and the transforming growth factor beta levels can be increased, which will lead to this the activation of the fibroblast, and which will lead to myofibroblasts, which can lead to the deposition of this collagen as well as fibronectin, and that is the reason why the patients may progress to pulmonary fibrosis in those who develop this pneumonia. So this is the natural history of post-COVID fibrosis. Majority of the patients, it do not require just with steroids and all, the patients will improve. But in certain patients, it may remain static, and certain patients, it's actually a handful of patients with this COVID bronchopneumonia can progress to have this ongoing fibrosis or the BOOP-like manifestation. And it is in these patients that we may have to think about antifibrotic drugs. And then it is not only the lung which is severely damaged by COVID-19, but the heart can also get affected. And we do have a study from Germany which showed that it looked at the cardiac MRI. The cardiac MR was done. It's not based on echo findings. This cardiac MRI findings showed that even after a median of 71 days after COVID-19 diagnosis, cardiac involvement was present in 78% with evidence of ongoing myocardial inflammation 60%. Okay, so and the presence of this chronic comorbidities, duration, severity of COVID-19 illness, and the time since original diagnosis was made did not correlate with this finding. So it shows that even in those with mild illness, there can be subtle cardiac anomalies like myopericarditis, which may not be picked up by the usual modalities of imaging like echocardiography. And it's a recent study from JSCC, which shows that this in athletes means that those patients with mild symptoms, even in them, around 27% had pericardial inflammation. This is actually picked up by cardiac MR imaging. Myocardial imaging in around 16% and myopericarditis in around 12%. This becomes important not for people like us whose the level of exertion may not be so huge, our body may be able to compensate for it. But then if he happens to be athletes and all, and if suppose we had a mildly symptomatic or asymptomatic infection and we did have this myopericarditis which went unnoticed, if we suddenly resume our usual level of activity, that is a level of activity on par with athletes and all, then probably we are in for some trouble. So in US and all, so the professional athletes, if they had this COVID-19, are supposed to have a cardiac MR fitness prior to resuming their usual training sessions. This is just to highlight the fact that COVID-19 can also affect the heart. It may not be that much apparent, even in those with a mildly symptomatic infection. A mild pericarditis or a myopericarditis can occur in around, say, 15%. It's important. So in short, the one which we are really worried about is the presence of exertional dyspnea. So this is actually the algorithm from the state post-COVID protocol. So if the patient is coming to you with exertional dyspnea after discharge, it could be anemia, it could be a respiratory cause like fibrosis or embolism, or it could be a cardiological cause like myocarditis, LV systolic or diastolic dysfunction or cardiomyopathy. So we need to have a stepwise approach. We need to look at the hemogram, the CRP, the D-dimer levels. May have to perform investigations like the pulmonary function test, X-ray, HRCT, echo, and if the D-dimer is elevated, we may have to think about this embolism and may have to do the CTPS, pulmonary angiogram. And if all the investigations are normal, and if your usual level of activity is pretty high, like that of an athlete, and you are still having exertional dyspnea, which is not revealed by the above investigations, probably you may have to consider a cardiac MR imaging as well. And this is very, as part of the post-COVID syndrome, the most ominous one will be something known as the multi-system inflammatory syndrome in children. Is up to 21 years of age, or is equivalent in adults, which is a far more rarer, that is the multi-system inflammatory syndrome in adults. So this is actually very important because you know that the children are usually not that severely affected. But even in those patients with mildly symptomatic infection, after say a lag period of say around 25 days, the virus can actually set in motion this macrophage activation, as well as the stimulation of the T helper cells, the B cells, plasma cells. So there is sort of a cytokine storm, which can lead to multi-system inflammatory syndrome, which can usually manifest like this Kawasaki disease in children. In adults also, they can present with multi-system inflammatory syndrome. So this is actually what has been triggered by this COVID-19. So in order to diagnose this, at the time of infection, this antigen test or a PCR may be negative because the heat occurred around say 3 weeks back. So will we diagnose this multi-system inflammatory syndrome? It is by a constellation of symptoms. The patient can present myocarditis and may some manifestation. Multiple systems will be involved, like meningeal irritation, so the presence of pericholecystic edema, the rash, the mucositis, the oral ulceration. Patient have myocarditis, which is supposed to be edematous myocarditis. In children, you can have these coronary aneurysms, you can have acute kidney injury, the mesenteric adenitis, etc. All the inflammatory markers will be very much elevated, like the CRP, the D-dimer, the interleukin-6 levels, the procal levels, etc. So how will we tie to the initial insult by this COVID virus is based on the antibody levels. Usually the COVID IgG antibody levels will be very much elevated in those patients with MISC or MISA. So in short, so in patients from this containment areas, if they are coming with atypical manifestations like large vessel stroke or young patients with multi-vessel stroke, Kawasaki-like illness, which is inflammatory state in children, the multi-system inflammatory syndrome, hyperinflammatory shock, toxic shock syndrome, acute MI, GBS, encephalitis, ADEM, olfactory, gustatory dysfunction, conjunctivitis, etc. There also you need to think that probably these events could have been triggered by a SARS-CoV-2 infection. And this is actually the algorithm so that around 2,000 post-COVID clinics. And we are focusing only on the red flag signs as of now, that is those with dyspnea, palpitation, chest pain, unilateral pedal edema or syncope, because we want to avoid crowding occurring in our post-COVID clinics. So post-COVID clinics has been set up in 3 tiers. The first tier will be in the PHC, FHC and the CHC. The second tier in the district hospital or taluk hospital. And the third tier in the general hospital as well as medical college. So usually the telemedicine platform is being utilized. Those patients with say, sleep disturbance, etc., will be addressed over the telephone itself. Those with the red flag signs will be evaluated, and if they require further evaluation, say suppose they are suspecting this embolism or fibrosis, etc., they will be referred to the specialist. This is basically the management approach, which I am not going into the detail. So this is basically what we are doing. we are focusing on this pulmonary rehabilitation for those with the exertional dyspnea, and if there is evidence of bronchopneumonia progressing to interstitial thickening and fibrosis. So pulmonary rehabilitation, the videos are available in the state site. Then in a subset of patients with ongoing fibrosis, they may benefit from this antifibrotic. So along with steroids, the antifibrotics like pirfenidone, nintedanib, etc. are being used. That is after getting a pulmonology consultation. The use of anticoagulants, we know that certain subset of patients, they are likely to develop this venous as well as arterial thrombosis even after discharge because of ongoing inflammation as well as endotheliopathy as well as activation of the coagulation cascade. So based on the improved VT score and based on the D-dimer levels, we handpick patients who may require long-term anticoagulation. Those patients with evidence of cardiac arrhythmias or failure will be managed accordingly, and those with chronic fatigue syndrome. So this is an area where actually we don't have much of an answer. So how to tackle this chronic fatigue syndrome? As of now, we don't have any proven treatment for this chronic fatigue syndrome. What we try to do is to address the reversible causes of fatigability, like say hypothyroidism or hypoadrenalism or the vitamin D deficiency, because as discussed, the post-COVID manifestations are probably due to this autoantibodies, and those patients with thyroiditis, etc., their requirement of thyroxine may go up after this COVID-19. So we do the TFT test, and if the TSH is not in range, probably we may hike up the dose of this thyroxine required. The vitamin D deficiency will be addressed. We use omega-3 fatty acids as well as vitamin E, even though we don't have that much evidence for using all these drugs. And the last one is those with the migraine headache or this neuralgic pain, etc. So we have observed that in females, they may have this the triggering of this vascular headache as well as persistent neuralgic pain, etc. They'll be treated as per the treatment protocol for the same. So thank you very much for this this opportunity to be part of this important national seminar. Thank you very much, sir, for this opportunity. Thank you very much. I think you are muted, not able to hear.
Okay, sir. Sir, now it is the time for discussion. Professor Dr. Murali sir will be moderating the session. The participants who has joined us online will be asking questions pertaining to the presentation. Are we audible to you, sir? Dr. Aravind, sir?
Yeah, I can.
Okay,
I
sir.
can.
Thank you, sir.
Three. Can you hear, sir?
Yes, I can hear you, sir.
So there are so many questions have arrived through the chat box, and we have selected the relevant 3 questions only because of shortage of time. So one question is that, is vaccination advisable for post-COVID patients?
Actually, as per the recommendations of WHO, CDC, as well as our national authorities, those with COVID-19 also should undergo vaccination, and ideal time is 1 to 2 months after a complete recovery. Why they should take vaccination is that you know that majority of the patients, even after recovery, may not mount a robust immune response, and vaccine, because of the presence of adjuvant and all, is believed that can result in a more immunogenicity than natural infection, even though it has not been proved as of now. So the current recommendation is that those with the infection who have been recovered should undergo vaccination 1 to 2 months later.
Thank you, sir. Next question is, please enlighten us on why women are more prone to autoimmune diseases.
Actually, why I said like that is, if you look at the post-COVID in 2 ways, that is those with, post-critical illness, post-COVID symptoms, definitely the males are the ones, because they are the ones who end up in ICU requiring critical care and all. But if you look at those with the mildly symptomatic COVID-19 or asymptomatic COVID-19 developing these symptoms later on, that is the ongoing post-COVID symptoms, in those with mildly symptomatic disease to begin with, definitely the females are the ones in all the studies, in our experience also.
Thank you, sir. Last question is vaccination advisable for patients who are immunocompromised?
Now the vaccination is advisable for those who are immunocompromised as well, because we are not using any live viral vaccine, so they can be given to immunocompromised patients. We are not bothered about the safety, but immunogenicity, is it there? When compared to the immunocompetent, we are not really sure, because a group of patients have never been included in any of the clinical trials. So it's not contradicted, it can be given. Safety is assured, but immunogenicity we are not sure.
Thank you, sir. Thank you.
Thank you, Dr.
Thank
Aravind,
you.
sir. Thank you, Dr. Murli, sir. So next is the presentation by Dr. E. Mukesh, sir, Assistant Professor, Department of Roga Nidana, VPSV Ayurveda College, Kottakkal. Dr. Mukesh, sir, has joined us online. We invite you, sir, to present the paper on the topic, Post-COVID Syndrome, Scope of Ayurveda. Dr. Mukesh, sir, please.
Am I audible?
Yes, sir. Yes, sir.
So I'm sharing my screen. Is my screen visible to you?
Yes, yes, sir.
Okay. Good morning to all, respected dignitaries and all the participants in this seminar. First of all, I would like to extend my gratitude towards my mother institution for inviting me to speak in this August event. So, remembering the great visionary Vaidyaratnam P.S. Vaidya, who made Ayurveda accessible to the common man. So let me go into my presentation. So the topic is the scope of Ayurveda in COVID-19, post-COVID-19 syndromes. So there is one important question that we have to answer is, what can happen after COVID-19 to a person? So there are three possibilities. One is a complete recovery without any health issues. Second one is the patient may land up in an acute respiratory distress syndrome or a multi-organ dysfunction and culminating to death, or the patient can survive with post-COVID syndromes or complications. And as per the data, as Dr. Aravind spoke just before, so only 65% of the patients return to their previous level of health even after 3 weeks of the positive test. And around 10 to 15% of the patients remain very unwell beyond 3 weeks of the illness. And there are other data as well emerging from different parts of the world. So as a responsible medical stream, we are also supposed to act on public interest as well as the interest of our science. So the question is, what can we do to help these patients who recover from COVID-19? So that's what we are going to discuss. You please forgive me if I repeat some of the things that has been already spoken by the previous speaker, because the topic is very specific. So maybe something I'll also repeat. So please forgive me for that. So as Arvind sir told, there are a lot of terminologies that has been used to identify this, like long COVID, post-COVID syndrome, etc., etc. But as far as this ongoing illness is concerned, there has been a consensus that is developed is post-acute COVID-19, when the illness extends beyond 3 weeks from the onset of the first symptoms, and chronic COVID-19 if the illness again persists beyond a period of 12 weeks. And another thing that we have to keep in mind is whenever we see patients suspected of having a post-COVID-19 or a long COVID-19 status, a positive test for COVID-19 is not a prerequisite for at least suspecting the diagnosis. Why? Because we know that this is an ongoing pandemic. A lot of individuals might not have been subjected for what you call the clinical investigations. So a positive test for COVID-19 is not a prerequisite, but we can go for the investigation later on if we suspect. So a high level of suspicion on the part of clinician is very important. Even now, I think most of us practitioners can see that a lot of patients now have started attending our clinics complaining of fatigue. And if you ask them the history of COVID-19, they may not be knowing that, whether they had the COVID-19 or not. So that is why this point has to be kept in our mind. So the possible mechanisms, as Arvind sir told, includes a persistent viremia that extends beyond a particular time period because the body was not able to mount a proper immune response. Another possibility is the chronic inflammatory status that is triggered by this viral infection, and the permanent damage, this permanent organ damages that can happen due to the illness. And sometimes, especially in the aged individuals, there may be some pre-existing health conditions. So this COVID-19 will have an impact on the pre-existing health conditions like diabetes, hypertension, etc., etc. And the other mechanism include deconditioning, especially the respiratory deconditioning that can happen because of the illness. And even the mental factors like post-traumatic stress and depression. So these are some of the possible mechanisms that can explain what is going on in these patients nowadays. So there are 4 syndromes, as Arvind sir told. It can be considered 4 categories like long-term COVID-19, permanent organ damage, post-viral fatigue syndrome, and the patients who have been hospitalized in a critical care facility, they may develop a post-intensive care syndrome. So these are the 4 type of or spectrums of manifestations that can come to us in practice, and we have to prepare ourselves to address all these things in practice. So what are the usually commonly reported symptoms? So the common symptoms that we now see in practice is cough, especially dry cough, a low-grade fever in certain patients, and of course fatigue. Fatigue is the most commonest symptom that is reported after COVID-19. The patients also complains about shortness of breath, chest pain, headaches and other cognitive difficulties, muscle pain and weakness, gastrointestinal upset, then metabolic disruption, especially it has been reported that COVID-19 patients had a new onset diabetes or worsening of the diabetes. So metabolic disruptions. Then, of course, the skin manifestations like vesicular, maculopapular, again, even COVID toe. Now, this COVID tongue has been explained. So, like that, there are a lot of manifestations that is seen because this is an ongoing illness. The data is incomplete, and you may even get to see newer manifestations in the coming period. So, what is the Ayurvedic approach in post-COVID? So, the 3 questions that arises to an Ayurvedic community is that the first thing is, are we capable of evaluating and managing these patients? That is the first question. Second thing is, which spectrums of diseases we should consider when we approach a patient with COVID or post-COVID-19 status? And what are the targets of this Ayurvedic intervention? So these are the 3 important questions that we have to find answer for. So first is the evaluation part. So just like Arvind sir told, we have to train ourselves and our doctors to evaluate these patients. So a full history, and especially regarding the current symptomatology in the patient, its nature and severity, especially the assessment of the quality of life and the activities of daily living has to be recorded. And also we have to assess the comorbidities, whether the patient had before the onset or the patient developed some comorbidities along with this illness. And regarding the clinical examination, we have to mainly concentrate on assessing the vitals. That includes the temperature, heart rate and rhythm, and BP, of course, and pulse oximetry, we all know. And the functional status, we have several tools for assessing the functional status of the patient. So the functional status assessment is an important part. And the systemic examination as per indicated in the patient, because this can vary depending upon the symptomatology in the patient. But the main concern should be the respiratory and cardiovascular system, because these are the most commonest systems involved in this disease. And regarding the lab investigations, again, a complete blood count, then the CRP, ferritin, especially the CRP and ferritin will help us to identify the ongoing inflammation, because these are acute phase reactants. So whenever these reactants are raised, then we can understand that the inflammatory process is ongoing, and we need to monitor the patient on a regular basis. Then the D dimer, again, it indicates a coagulopathy. So one interesting finding is that what we have seen in patients is that even after testing negative for the COVID-19, the patient can develop coagulopathy. So we have to keep in mind that once the patient gets a COVID antigen negative test, we should not take it carelessly, because we have to monitor the patient on a regular basis. Then, of course, in an elderly, we can go for the electrolyte assessment. liver function and renal function test, because these transaminase levels can be increased. Again, renal function, especially the kidneys being one of the commonly affected organs. So renal function test is very important. Then troponin levels, that indicates cardiac injury. Creatine kinase, again, muscle. Then BNP also can be assessed, because BNP will give you an idea about worsening pulmonary function. And chest X-ray, especially as an initial tool for identifying lung fibrosis, but CT is reported to be more sensitive than chest X-ray in identifying lung fibrosis. Urine analysis, and of course an ECG. So these are some of the commonest tests that we can order when we analyze the patient clinically in a post-COVID scenario. And again, there are other investigations as well, because that depends upon the clinical indication in the patient. And as far as Ayurvedic doctors are concerned, it's very important for us to analyze the patient on an Ayurvedic viewpoint, and we have to analyze the Ayurvedic therapeutic indicators, including the Prakriti, Vikriti, Dosha, Dusha status, Agni of the patient, etc., etc. Especially, we have to take care of the Rasa component and Ojas component that I'm going to discuss later on. So these forms the clinical assessment of the patient. And again, we have to keep in mind when we have to refer a patient to a tertiary medical center, because these are called as the red flags, as Arvind sir told before. The worsening breathlessness, that is one of the important signs when we should not keep the patient, because the patient may need an external respiratory support. And whenever the partial pressure of the oxygen that may go beyond or below the 96% on a consistent basis, a one-time reading is not beneficial. You have to monitor continuously, and if the persistently the reading is below 96, then you have to the patient may need oxygen supplementation, so we have to refer the patient. And if the patient develops an unexplained chest pain or a new onset confusion, then again we have to refer the patient. And if the patient develops a sudden focal weakness, also we have to refer the patient. So let us look at the Samprati before going into the scope of management. Considering this as a Aupasargika Roga or a Janapado Dhamsa that we know, we can consider this primary Nidana as Agantuja. And of course, there is a involvement of or a role for the what you call Nija factors, because if the patient has good Agni and good Sara, etc., etc., then the patient may prevent the manifestation of a full-fledged disease. So that is why if the Pratyaniga Bala is intact, then the patient may not have any illness. But if the Pratyaniga Bala is variable, then the patient have variable manifestations depending upon the what you call the interaction between the causative factor and the Pratyaniga Bala. So suppose the Pratyaniga Bala is very low, then the patient can end up in a state of Sannibadha Jwara. Especially what we have seen is that it's a Vata Kapha predominant Sannibadha Jwara. And of course, there can be Pitta predominance in few of the cases. And predominantly involved Srodhases are found as Pranavaha, Rasavaha, and Annavaha Srodhas. Other Srodhas are also involved, but mainly we have to concentrate on these Srodhases. Rasa, Rakta, and Ojas are the predominant factors or dushyas that we can say that are involved in this patient, in this disease. And Marma involvement can be seen in complicated cases, especially the Hridaya and Shiro Marmas, and even Vasti Marmas can be involved as a part of this Sannibadha Jwara Samprati. So what happens to the patient? So of course, whenever there is a Sannibadha Jwara, there can be Dhatu involvement. And if the patient undergoes a proper dosha paga with the medicines or without medicines, then the patient gets free of the disease. And whenever there is a Leena dosha avastha, then the patient can have Leena Jwara or Punaravartaka Jwara. And if the patient undergoes Dhatu paga, then the patient can end up in a complicated stage. That means Vaikalya, or what you call as end organ damages, or even Marana. So this is what you call a simple overview of the Samprati. And these are some of the textual references that we have to keep in mind whenever we make a clinical approach to the patient. Especially the concept of Leena Jwara is very important, where Dina, Shvayadu, Glani, etc. are explained. Punaravartaka Jwara is again very important. And Vaikalya, even we know that the Sannibadha Jwara has been explained. And when the Sadhya Sadhya is being explained, then he says Vaikalya do Abhiva. So the patient can get rid of the disease, but with complications. So this also can happen. So what are the spectrums of manifestation that we can see in the patients? So in terms of a long COVID or a chronic COVID-19 disease, the patient usually presents with a Jeerna Jwara or a Leena Jwara or a Dhadugada Jwara manifestations. In case of post-viral fatigue, we can see it has a Punaravartaka Jwara or a Vyadhijanya Shosha or an Ojakshaya. In case of organ damage, again, the spectrums of manifestation can depend depending upon the or change depending upon the organ that is being involved. So whenever the patient comes with the pulmonary complications, usually a symptomatology resembling the Kshayaja Kasa or Shwasa is present in the patient. And in case of renal complications, the patient can present as Shofa. In case of liver, it can appear as Kamala. In case of Hridaya, it can appear as Hridroga or Shofa. And even in neurological manifestations, we can see Vada Vyadhi. And in psychological, especially pertaining to the Ojakshay and Unmada. So these are the spectrums of manifestations that we should keep in our mind whenever we approach a patient with the post-COVID-19 status. One thing that we have to take care of is that the assessment should be based on Ayurvedic parameters before prescribing, because always that only will give you an idea so that which Aushadha Yoga you have to select for managing the patient. So what are the scopes of Ayurvedic care? As we told, we have already discussed the Samprati, and we know that 4 different forms of COVID-19 patients that can present to us. So the management can be of residual symptoms, or we can give medicines for post-COVID rehabilitation of the patient, or we can give our medicines for addressing the comorbidities that the patient has, or we can, just like in the preventive aspect that we have already done, we can again give medicines for a reinfection, because we don't know whether how many of these patients can get reinfected in the future, because this is a long-term illness. Again, we may have to deal with this for a period of next coming at least 1.5 to 2 years, I think. So we have to prevent reinfections in the patients, and also the psychological support. And one thing that we have to keep in mind is we can either give our medicines as a standalone measure or as an add-on measure. Why this I'm saying is because there are certain cutoff point where sometimes a modern care may be needed for the patient. So within that cutoff point, we can give our medicines as a standalone care. And beyond that, of course, we can always give our medicines as an add-on care so that we can accelerate the patient recovery. So first is let us look into the management of residual symptoms. So we can we can manage the prolonged symptomatologies. We can enable an early recovery, as we have seen since the lockdown has been lifted and people started getting quarantined in their homes itself. We got a lot of patients who took our Ayurvedic medicines, and what we have found is that those patients who have taken our medicines, they either don't end up in all these complications, and they have an early recovery of the disease. So starting Ayurvedic medicines in an early stage is always very important as far as preventing complications are concerned. And also we can address permanent organ damages. So these are some of the residual symptoms that we see. This has already been discussed by Aravind sir, so I am not going to again read it. Again, D-dimer levels are very important, because this coagulopathy can lead to stroke or coronary artery diseases. So this is why this is very important. Again, the patient can develop pulmonary embolism and other complications. So this is very important. So the treatment of long COVID can be done in the lines of Jeerna Jwara Chikitsa, especially Pajana, Deepan, and Shamana. I'm not going to name any medicines here, because the speakers who are going to speak after me, they are going in detail about all these and with their treatment experiences. That is why I have not listed any of the medications that we use here. But I just want to highlight that our scientific principles are strong enough to address all these things even in the present era. So we can manage long COVID with the Jeerna Jwara Chikitsa, including Pajana, Deepan, and Shamana. And sometimes the patient can end up in a Leena Jwara status, so that a Pajana and Mrudu Shodhana. Again, Mrudu Shodhana, even I have tried in some patients. Of course, we have to see the Adura Bala before giving Shodhana. But I have tried mild Virajana with Avipatti Churna, etc. And the patient responds very nicely. Because Virajana always improves or has significant results in controlling inflammation. Because this ongoing inflammation is a very important what you call predictor or determinant in the outcome in the patient. Controlling that inflammation is very important. So Lankhana as well as Virajana or Mrudu Shodhana is very important in controlling that inflammation. So that is why Pajana and Mrudu Shodhana. And of course, Rasayana is a very important principle. And this is the only what you call highlight that we as Ayurvedic doctors can claim apart from modern medicine, because this concept of Rasayana is very unique to our science. So I think that we should practice in these patients. And regarding the complications, again, we can address these pulmonary complications like fibrotic lung disease, bronchiectasis. Again, there are a lot of cases being reported with bronchiectasis. So we can incorporate our Rajayakshma, Kshayaja Kasa, Chikitsa in that. even we can advise the patient, because modern pulmonologists, they have been developing certain breathing techniques for bringing the patient back to his normal functioning. So we can advise pranayama in a restricted mode. In case of renal complications, we can go for treating the patients. Especially in my personal practice, I have seen that we can keep the patient up to the creatinine in the range of 6 to 7. Beyond that, the patient may, again up to 12, then the patient may need dialysis. So we can treat in the line of Agni and Vada and Lobana Chikitsa and Shofa Chikitsa. And medicated diet is again a very important aspect of management. Regarding the cardiac, again, we have our restrictions. Sometimes the patient may need modern care. However, if we get a chance to treat the patients, we can go in the line of Jora, Shwasa, and Hridrog and Shofa Chikitsa. Liver failure, of course, we know that we are better than modern medicine in managing liver complications. So Pandu, Kamala, and Lina Jora Chikitsa can be followed. And regarding the neurological manifestations, there are a lot of cases being reported with the transverse myelitis, myasthenia gravis, and even seizures and new onset epilepsy. So we can manage those patients in the line of, again, Lina Jura, Vada Vyadhi, Vada Rakta, and Unmada Vasmara line of management. Next is the post-COVID rehabilitation. We have seen that even with the patients who were asymptomatic but tested positive, or even in patients who were mildly symptomatic, they tend to have this long-term fatigue and breathlessness. So we can go for a small Pajana Dibana followed by Brahmana and Rasayana measures. Why? Because this aspect is very important, because the patient can otherwise develop other complications as well. So that is why post-COVID rehabilitation, we have a very important role. And post-viral fatigue syndrome, this is again another important thing that is being reported in the COVID pandemic. So this is also known as myalgic encephalomyelitis, and this has been reported with other viral illnesses like Epstein-Barr virus, etc., etc. And usually this happens due to an autonomic dysfunction, and it can manifest as a high fever. And there are a lot of theories that are being stipulated why this happens. And there are theories of involvement of the glial cells in the brain, inflammatory process going on in the brain, and role of immune system in causing this post-viral fatigue. There are a lot of theories going on, a lot of postulations. But I think apart from modern medicine, Ayurvedic medicines can treat these patients in a better way. Usually the patient presents with persistent fatigue, diffuse myalgia, and depressive symptoms. And also, they will have some disruption of their sleep-wake cycle. So we know that ojas can get affected as a part of Sannivala Jara. And when ojas is affected, there will be features like Daurbalya, Vedidendriya, so that there is cognitive decline. The Indriyas cannot function properly, and the patient can end up in Dushchayo, Durmano, Ruksho Bhavet, etc., etc. So addressing that ojas component is very important in managing these patients. So when the patient develops fever in the post-infective stage, then we have to consider under the concept of Punaravartaka Jara, and we can go for a Mrudu Shodhana, then Brahmana and Aujasya measures, and Sattva Chikitsa also should be done in this post-viral fatigue syndromes. And again, one thing that I have to highlight is that the Brahmana Chikitsa is again important in patients who becomes Krisha after a Vyadhi. So that is why Acharya has told Brahmahet, Vyadhi, Vaishajya, Madhyastri, Shoga, Karshidan. So that is why a Brahmana Chikitsa is always very important. And regarding the post-intensive care syndrome, this is usually seen in patients who have been taken care of in a critical care facility for a prolonged time, so that there can be deconditioning of the patient's respiratory function or cardiac functions. And also the patient, because of getting isolated, a patient can have psychiatric manifestations as well. So there can be impairment in the cognition, psychological health, as well as the physical function of the patients. So the treatment, again, we can consider in the line of Vyadhi-janya Shosha, because Shosha can happen secondary to a Vyadhi. And another thing that we have to keep in mind is we have to reduce the number of medicines that we prescribe to these patients, because they may not be even having the bala to tolerate the medicines as well. So that is why Beshaja Kshabide Patyam Ahare Brahmanam Kramat is told. So that diet, especially medicated diets, are more important than medicines in such patients. Of course, you can go for some minimal medicines for Pajana, Dibana, etc. And in the initial period of treatment, we have to keep medicines minimum and a diet as a maximum one. And Sattva Chikitsa is again very important in managing such patients. And regarding the comorbidities, we have to go for Yada Vyadhi Shamana Chikitsa, because I am not going into detail because of the time limit. So actually, depending upon the illness in the patient, we can go for giving our medicines, especially diabetes, hypertension, etc. We can add on with our Ayurvedic medicines according to the manifestation of the patient. And regarding the preventing the reinfection is concerned, there have been reports of patients who have got reinfected with COVID-19. So we don't know on a long-term basis what is going to happen because the future is still waiting for us. So there is a concept of Anubandha Chikitsa told in Charaka where we should go for Deepana, Balavardhana and Rasayana measures even in patients whom we see that they are very well. So Ayurveda has a role more than modern medicine in doing such things. Of course, vaccination is there and it's an ongoing process. But we know that our population to vaccinate the whole population takes time. So in between we can intervene, and as a responsible what you call public healthcare system, we can also give our medications to prevent reinfection. And regarding the post-COVID psychiatric disorders, I think we have a tremendous scope in managing those with our Sattva Chikitsa, which can include counseling, meditation techniques, and even occupational therapy. I think occupational therapy is very important, especially in patients who got into deconditioning status because they need a full-scale rehabilitation to bring them back to normal, what you call, to carry out their activities of daily living and normal life. So even in our college, we have seen the patients with post-traumatic stress disorders and depression, they have started coming. I think in our IP under Manasika Roga department, they have few patients now they are managing which happened due to COVID-19. And we cannot undermine the importance of diet and lifestyle in managing these diseases. So a tailored diet, this is again very important. The diet has to be tailored to every given patient. We cannot give a blanket diet and ask everyone to follow that. We have to tailor the diet in every patient. And pranayama and other breathing techniques, as I explained earlier, yoga and other specific lifestyle modification internet for specific individuals has to be an integral part of managing the patients. So these are about the scopes. And before concluding, let us take a SWOT analysis where Ayurveda stands now. So the strength and weakness is internal and opportunity and threat are external factors. So internally, I think we have strong fundamental principles to tackle this illness. And we have wide therapeutic measures to address every situation that comes apart from the critical care. And we also have safe and cost-effective medicines that can be given. And regarding the weaknesses, actually, the main Achilles heel has been the research and documentation part. But I think since last 1 year, since the COVID pandemic happened, most of the Ayurvedic facilities and even the Ayush systems have started the research and documentation. So I think coming in the coming period, we will have more data with us to claim that we also have a role in this pandemic. And another one important thing that I found wanting is that insufficient clinical training, so that our clinicians has to be equipped to evaluate these patients and how to examine these patients, what all investigation should be done, and when to refer, etc. So we have to go for a full-fledged training programs for all these clinicians to manage this COVID-19 illness. Regarding the opportunities, I think that we have a very good opportunity for being a widely accepted medical system among, especially in Kerala, it's a widely accepted medical system. And of course, we are getting very good support from all the government bodies. And regarding the threat, I think there is a lack of coordination in our efforts. So that is one of the threats. And public awareness, I think still it is lacking. We are accepted as a medical system, but the public is not that much aware regarding what Ayurveda can do in all these post-COVID complications. So I think we should step up our efforts to create public awareness more. And also there are some operational and logistic concerns. For example, when we started the prevention program, suddenly there were shortages of Vilvadi Gulika, etc. So like that, there are a lot of logistical and operational concerns that we have to address. So I think with that, I would like to end my talk on the scope of Ayurveda in COVID-19. I thank the organizers, and I also thank my institution, VPSV Ayurveda College Kottakkal, all the faculties, my mentors, for equipping me to speak on behalf of our college in this August seminar. And I thank you once again.
Thank you, sir. Now we shall move on to the discussion part. I would request Professor Dr. K. Murli sir to moderate the session.
Thank you, Dr. Mukesh, for a nice presentation. We have so many questions, but most of the questions are actually answered in your presentation itself. But few more explanation can be added, which will be more informative to the participants. One question is that organ damage being a major complication of COVID-19, how do we interpret the scope of Panchakarma or Shodhana Chikitsa in this condition? Mukesh?
Sir, my experiences are very less in that aspect because we have only started getting all these patients. So I think
Sir,
maybe
your
after.
voice is not audible. Mukesh sir?
Am I audible now?
Sir, please check your mic.
Am I audible now?
Yes, sir. Yes, sir. Thank you.
Okay. Sir, my experiences in this regard is very less because we have only started getting all these patients in our practice now. But I think there is a scope for Panchakarma, but provided we have to think about the Rogi Bala, because if the patient is not able to tolerate uh, Shodhana procedures as such, then we may have to postpone it until the patient becomes Balavan to tolerate the Shodhana procedures. So in the meantime, we can go for Shamana procedures, and afterwards we can think about that. Right? But I think I have tried this Mrudu Shodhana in a few patients, and they found it to tolerate very nicely. And regarding I think the role, I think there should be a cutoff point so that we should have a consensus up to what level we keep the patients and when we have to refer the patient. Because in patients who, especially in case of lung fibrosis and all, if the patient is not able to maintain the oxygen concentration in the blood, then we cannot keep the patient. So in a minimal case of fibrosis and even in complications like bronchiectasis, I think if the oxygen saturation is within normal limits, we can keep the patient and we can try to reverse. Because not in COVID-19, but in other cases, we have seen that our medicines are very effective in conditions like pulmonary fibrosis and bronchiectasis. So I think we have a scope, but there should be a cutoff point beyond which we refer the patient.
So another question is the relation between the serum ferritin and the inflammation. How this test can be used to assess inflammation?
Actually, there are a lot of markers called as acute phase reactants, and C-reactive protein and ferritin is one among them. And if the ferritin levels and CRP are increased, then we have to think that there is an ongoing inflammation. So we have to keep watch so that the patient may land up in complications, because this inflammatory procedures can lead to coagulopathy, and this coagulopathy, I think it's a very serious clinical condition that we may have to refer the patient. So that is why ferritin is an important marker. Why ferritin specifically is because there are also CRP can be raised in other inflammations as well. But once this COVID pandemic emerged, then ferritin was reported more because it is. There are some other illnesses where CRP is more, but ferritin is not that much high. But in case of COVID-19, ferritin is also found to be very high. So as an acute phase reactant, it is very beneficial to monitor the patient.
Dr. Mukesh, one of the delegates wants to know more about the scope of Ayurveda in post-COVID traumatic stress disorder.
Actually, I think our faculties from the Manasika Roga department will be more authoritative in addressing that. But personally, I think we have a significant role in that, because our own modalities like Ayurvedic medications, along with all this meditation and pranayama and yoga techniques, I think we can bring them back to normal life. Because in modern medicine, they have their what you call internal medicines that we can give. But our medicines will provide more safe, cost-effective, without much complications and side effects. I think we can manage post-traumatic stress disorder in a better way than modern medicine.
One more question. One of the delegates wants to know more about the scope of Ayurveda in patients with cardiac or renal complications.
Regarding the renal complication, acute renal failure, it is better to refer the patient. But in case of a patient who develops chronic kidney diseases, I think Ayurveda has a role. Especially, we can go for the lines of Deepana, Agni Deepana, and Vada and Lomana measures. Because kidney is more related to Agni than Mutra Vasrodhas. So that is why in renal failure, we can manage chronic renal failure. But however, in case of cardiac disease, I have my reservations because in patients with acute myocarditis and other complications, I think it is better to keep the patient in a modern facility. But in case of patients who develop arrhythmias and who are clinically stable, I think we have some role. We can give our medications.
Thank you. Thank you, Dr. Mukesh.
Thank you, sir. Dr. S. Rajagopala, Associate Professor and Head Department of Kaumara Bhratya, All India Institute of Ayurveda, New Delhi, is going to be our next speaker. Sir will be speaking on the topic post-COVID-19 management symptoms, principles, and experiences. Sir has joined us with our online. We respectfully invite you to present on the topic, sir.
Good morning, everybody. Am I audible?
Yes.
Yeah. Screen is properly shared, no?
Say yes. Yes.
Screen sharing?
Yes, sir. Screen is shared, sir.
Yeah, okay. Okay, thank you. Paying my homage and respects to the founder of Ayurveda Shala, I thank the organizers for giving me this opportunity to address you all on post-COVID-19 management, symptoms, principles, and experiences. Before starting my deliberations, I would like to thank my previous speakers too, who have made my task much simplified and easier. And some of the slides may appear repetitions, where of course it is unavoidable. This is from the institute from where I have come from, where I am representing the All India Institute of Ayurveda. Many of you are knowing that All India Institute of Ayurveda is one of the CHC, that is COVID Health Centers, recognized or approved by Ministry of Health and Family Welfare, and still we are running. Of course, because of the lower incidence and lower reporting, number of patients are gradually coming down. We treat mild to moderate cases of course, uncomplicated cases of COVID infections in our setup. And we have also established, once the COVID pandemic started coming down, incidence of post-COVID care, post-COVID complications increased, and we started a post-COVID care unit also in our institute, where we get a good number of patients attending. Many of the times what happens is patients are not aware that the complications or the complaints they have is because of the COVID, the disease which they have suffered earlier. So what we do is wherever there is a clear history of COVID infection earlier, with a negative RT-PCR report or negative RAT report, we refer them to this particular OPD, which is generally managed by Department of Kaya Chikitsa. And they are managing the conditions following with the principles, of course, which we are going to discuss earlier. Dr. Arvind had already discussed about long COVID or COVID post-COVID syndrome, that the condition which lasts more than 12 weeks or more, that is post-COVID syndrome, where multiple presentations we can see. The relevance is, yes, in every place, every state. Of course, Kerala stands now almost in the one or two, first or second position in the reporting of COVID cases, and post-COVID complications, post-COVID complaints, and all are again common over there also. This is a recent source where post-COVID complications are seen. The challenges are unpredictability of chronicity and severity of patient presentations. The thing is, earlier we were believing that the healthcare workers were more prone to the COVID infections because of the exposure and severity also, but it is not exactly so. Higher percentages again in the hospital or COVID warriors. The second thing challenge what we have is lack of documentation in the knowledge domain. Particularly, this disease is a very new disease. Even for the modern medicine, it is having a history of only at least just a year, not more than that. And emerging novel symptomatology, because every day we are hearing newer and newer presentations or newer and newer issues with the COVID infection. Ocular manifestation in the ear, or in Ayurveda, if you say Indriya Adhisthita Vyadhi, these presentations are appearing now, retinal complications and other things. So these are the challenges we have in understanding. This chart again, this already been presented by Dr. Arvind with regards to the presentation, post-COVID presentation, starting with fatigue to vomiting also. Most common thing is fatigue, a dry cough, headaches, generalized body aches or myalgia and arthralgia, what we call, and diarrhea. These are the most common complaints we come across with. Coming to the symptomatology, a detailed description has been given. Still, I'm just touching them. Some people who have COVID-19, whether they need hospitalization or not, or severity is serious, severity is high or low, continue to experience the symptoms including fatigue, respiratory and neurological symptoms. This is what WHO says. And this can last at least for 6 months or even longer in some people, because more than 1 year we cannot say, but longer presentations are seen. The studies from China, where the COVID epicenter was there, the studies also showing the same thing, longer episodes. Most common, as I said, is fatigue, joint pain, loss of taste, difficulty in breathing, chest pain, sleep issues, psychological issues like depression, anxiety and all, and brain fog. Brain fog already Dr. Arvind has described. It is related to the neuropsychiatric presentations. Some studies show 10% of the COVID, they develop post-COVID syndrome, and some other studies suggest more than 70% of people. Those who are having, or those who are at the risk of developing post-COVID syndrome are elderly people. As in case of COVID infection, again, we see more in elderly people who have experienced more severe cases or complications in the COVID infection stage, and underlying health conditions, comorbid conditions like hypertension, diabetes, obesity, or dependency on certain drugs like steroids or drugs for thyroid problems and all. Such conditions we see more of post-COVID complications. Coming to organ-specific presentations, we have cardiac-related palpitation, fatigue, chest pain, damage to heart muscles and all. And Dr. Arvind, again, he shared a reference from German study. MRI scan shows myocarditis. Whether they have cardiac illness earlier or not, it is irrespective of that. That means, yes, COVID can affect minor vital organs too. In the thromboembolic risks, we see pulmonary embolism, retinal manifestations or microvasculopathies, heart attack or stroke. In the lungs, we have got sore throat, very common presentation. Dry cough, chronic dry cough, it is again a very common presentation. Shortness of breath, exertional dyspnea, damage to lung tissues, and restrictive heart failure or lung failures. The gut issues or GI tract related presentations are anorexia, loss of appetite, abdominal pain, diarrhea, nausea, indigestion, and bloating of abdomen. The commonest is bloating of abdomen, anorexia, and diarrhea here. The brain fog, memory and concentration issues are very common in elderly. Peripheral neuropathy, pin and needle sensation all over specific areas of the body, or a generalized loss of smell or anosmia, aches and pains here and there, neurological pains. Mental issues like anxiety, depression, post-traumatic stress disorders, and sleep disturbances. The most common is sleep disturbances here. Musculoskeletal, other, as I already told, pain here and there. The muscle pains, muscle group pain, and arthralgia, either it may be a generalized or it may be a single joint involvement, and fatigue. Skin manifestations are commonly seen. Fungal infections or increased incidence of fungal infections are common. Discolorations, itching in the body, itching, non-specific itching, it is not very specific, and allergic rashes are also associated with the itching, and hair loss. It has also been reported. This is indriya or sense organ related specific presentations: tinnitus, otalgia, dizziness, dry cough and sore throat related to the throat, conjunctivitis and retinal circulation problems. That retinopathy, those who have already complaints with the retina, they have an increased incidence of such presentations. So coming to Ayurvedic view on this, as rightly said, Vikaranam Akushalona Jihniyat Kadachana Nahi Sarva Vikaranam Namatosti. Naming of a disease is not very important, but understanding of the disease is very important. And this is what Charaka in his Vimanasthana 6th chapter he says, Anutta Vyadhi. There is a shloka specific to this, or stanza specific to this. Tatra vyadhe aparisankhya bhavanti. The number of diseases, if you count, it is aparisankhya ati bahutvat. It can be getting added on to the number already existing. Dosha Stukara Parisankheya. Dosha is only 3 with their permutation and combinations. And based on that, Buddhiman, the intelligent physician, or we have to understand a disease, whether it is mentioned, okay, well and good, we have Nidana Panchaka and all other things we get in the books. Whereas those diseases which are not mentioned in the text, then we have to understand based upon the pathophysiology, the causative factors, the symptomatology and all. Rogam ekaikam, evam prakopanam, evam yonim, evam utthanam, atmanam, adhishtanam, vedanam, adi. Lot of things are explained here. And he also says, evam udarkam. Udarka is the post effect of the disease, a very specific disease. Vidya tasmin niyam pratekarartham pravrittihi athava nivrittir upadeshat. That means we have to plan the treatment, or we have to understand the disease first. We based upon various parameters related to the disease and to the patient also, and then we have to plan the treatment part. This is what he says. Whatever understanding we have on COVID-19 infection is as on today is based upon this. When we started planning for the guidelines for Ayurveda practitioners, guidelines for management, profile access and all, we had a gross understanding of all these things. Based upon that, we planned, or the total guideline and other things are framed up. And now whatever we are deliberating or whatever giving lecture, it is also based upon this. Further, Ayurveda, of course, these are the fundamentals of Ayurveda, like Agantra, Nvetinijam, Vikaram, and Deha, Dhatu, Agni, Balatva, Bala, Halam, Dosha, Halam. Bala is very important. Bala can be interpreted as Sharira Bala. Bala can be interpreted as Vayo Bala. Bala can be, in the present context of COVID, we can interpret it as the immune strength of the individual. Based upon these understandings, or following these principles of Ayurveda, we can see that there are 5 or 6 major srotasas are involved in the manifestation of post-COVID presentations. Pranava srotas is one, alpa shwasam, shwasa kasa, shwasa kashtata, or pulmonary manifestations. Anna and Purishava srota involvement, you can see Aruchi, Agnimandya, Tisara, Shula, and other things. Rasa Raktava sroto involvement, you can see with Ashraddha, Aruchi, Arasajnata, Angamarda, Jwara, and other things. And Mamsa Astivaha sroto involvement with the symptoms of Asti Bheda or Angamarda and other things. And Manova srotas, Unmadavat, or similar like Vishada and other things you can see. So, in general, all the srotasas, almost all the srotasas, my earlier speaker has included Ojas also, which is essence of all the dhatus are involved in the post-COVID presentations. The presentation may depend upon the individual's prakriti and the deha bala and other things, but you can see different presentations or different organ involvement in the disease process. Of course, we should not forget the indriyas also. Raktava srotas, dermatological manifestations, Samjnava srotas, Brahma, Klama, Adi, and Indriya Upatapa or Indriyas are also involved. Coming to the treatment part of this, let me share first our experience at All India Institute of Ayurveda. What we do is, we strictly follow the guideline given by Ministry of Health and Family Welfare in the post-COVID management, wherein Ayurvedic management or Ayurveda drugs are also included. The first thing is drug therapy. Depending upon the lakshana, what we get in the patient, the treatment is, the drugs are selected. Rehabilitation, we advise WHO guidelines and Ayurveda principles, yoga, exercise, and relaxation techniques. Tailor-made diet, it is also advised to the patients of post-COVID illnesses. Help of diet and Swasthavrta department is taken here. Yoga, pranayama, and recreation or relaxation techniques. These are also advised to the patients. These are the clips from the circular or protocol published by Ministry of Health and Family Welfare, where you can see immunity promoting Ayush medicines, which includes mulethi. Mulethi is yashtimadu, haldi milk or turmeric milk, gargling with the turmeric and salt, that is Kavalagraha or Gandusha, and Chavanaprasha, which is a standard or established rasayana, which can be given even in all age groups. This is being practiced at our place. Of course, along with that, along with this general protocol, we follow whatever is explained or whatever is suitable to the patient based upon his dosha, dhatu, and other conditions. The post-COVID protocol, as ministry says, it should be at individual level, it should be at community level, and it should be at healthcare facility level. Of course, all the three community level, of course, it is a social participation is important for that. Whereas in healthcare facility, we follow the same thing, and individual level, we advise the same thing. Coming to drug therapy or drugs used, the cornerstone for the main principle of Chikitsa is sthana, dosha, and avastha. These three things we have to consider. If sthana is prana or in the chest, then your prana was rotas, dosha, if it is usually what we get is vata kapha there, and avastha, what is the stage of the disease, this has to be seen. Based upon that, the treatment has to be planned or Chikitsa has to be planned. The main objectives will be before going, Vyadhi Kshinata and Bheshaja Kshinata of the patient has to be seen because already he is suffering, has suffered an illness, and hence Apakarshana Chikitsas are to be practiced with the caution. My previous speaker has spoken about Mrudu Virechana with Avipati Churna in inflammatory changes. Yes, inflammatory changes, if it is there, inflammation is there, role of Pitta comes there, and for Pitta, Virechana is good. But Tikshna or Shodhanatmaka Virechana, we cannot do in this because of Vyadhi Kshina and Bheshya Kshina condition of the patient. You can go for Mrudu Kshinata, Mrudu Virechana with Pitta Hara or Pitta Saraka drugs, and it should be with the proper supervision. Physical and mental components are equally important. Where comes the role of major rasayanas, restoration of quality of life, and for which Balya, Brahmana, and Rasayana. Brahmana is not very important here, but Balya and Rasayana are very important here. Such drugs can be used. The bipolarity of the disease, you can see in the post-COVID, some conditions are of Vata Kapha in predominance, and some conditions where Pitta involvement also will be seen. When we were talking about the COVID infection itself, we were telling that it is a Vata Kapha Pittanubandha Vyadhi, or it is a Tridoshaja Vyadhi with Vata Kapha predominancy or sometimes Pitta predominancy. So based upon this, we have to select the drugs. If it is Vata Kapha, then Vata Kapahara drugs like Dashamula will be ideal, where if Pitta Rakta involvement is seen, then there is the drugs like Pitta Hara, Guduchi, and Panchachikta and such type of drugs will be ideal, or such formulations will be ideal. Going ahead with this certain drugs, this is of course what we are using at our place and which are of course conducive to Vata Kapha and Vata Pitta Rakta conditions. There are a lot of drugs available, and the drugs actually it is left to the decision of the physician to decide. Only thing is principle we have to adopt. If Pranavasrotas is involved, Dashamula is one of the drugs. You can go for Trikatu, Haridra Khanda, Kantakari Avaleha, Dashamula Haritaki, Agatsya Haritaki, such like Avalehas. You can go for rasa preparations like Tribhuna Kirti, Shwasa Kotar and all. And we can use Pipali, Chitraka and Pushpanda Rasayana, Chavana Prasha, this type of drugs. Now herein again, one of the very well-established clinician, what his comment was, the role of Maricha. What he was telling is, Maricha is very good, right, in COVID infection as well as in post-COVID complications. But only thing is, Maricha is Ushna Tikshna. The Ushna Tikshnata and Pitta Vruddhi Lakshanas are to be checked. Keeping a view on that, Maricha can be used. Another observation what was presented is your drug Mahatiktaka Kashaya. Mahatiktaka Kashaya or Mahatiktaka Yoga is said to be very ideal in the management of COVID as well as post-COVID complications. Of course, Pitta predominant conditions, it will be ideal. Dashamula or Dashamula Kashaya, Dashamula Katutrayadi Kashaya, these can be used in case of Vata Kapha predominant conditions. The other drugs are shown here, Indukantam and Guduchiyadi Yoga, Amrutottara Kashayam. Depending upon the Doshik involvement, we can use Tali Sadi or Sudarshana Churna. Again, depending upon the Doshik conditions, Avipati is also mentioned here. And in the rasa preparations, Hridayarna Rasa, Prabhakaravati have shown good response in cardiac. Of course, this is not standalone treatment. It should be wherever vital organs are involved, we have to take care about the vital part. We can give as a standalone, the response is very good. The role of Ashwagandha in prophylaxis as well as...
Dr. Rajagopal sir, kindly excuse us, sir,
yes,
for the
please.
interruption.
Yeah, okay, please stop.
we shall resume the session. Dr. Rajagopal sir, please continue, sir.
Our respectful homages to Mahatma Gandhi ji, who was instrumental in freedom movement and freedom India. Okay, continuing with this. Yes, there are a lot of drugs available. The Annapurishava Srotas, Annavaha and Purishava Srotas, Hingvashtaka, Hingvachadi can be used, or Dashamula Haritaki, Chitragadi, Vati, Kamaduga. Of course, when Pitta is there, Pitta predominance, Pitta Rakta involvement, like Da and other things which we see, then we have to go for drugs like Patoladi, Drakshadi Kashaya, or Guruchadi Kashaya, Vipati Churna, Kamaduga, and Shekhara. Manovaha Srotas involvement, as we have heard already, Vishada, depression, anxiety, and such things are there. Medhya Rasayanas are of value, like Guruchi, Shankhapushpi, Ashtimadu, Brahmi, and all. Drugs which are having Ushna Tishna property in the Medhya Rasayanas, such like Vacha, Jyotishmati, these things better avoided because of their Ushna Tishnata nature. Kalyanaka Ghrita, if Agni is good, then you can go for Ghrita preparations like Kalyanaka Ghrita, Mahakalyanaka Ghrita, or Brahmi Ghrita, Saraswata Ghrita, and all. But drugs like again Panchagavya is little restricted one. Indriya involvements like eye, ear, particularly involvement is there. Then Nasya therapy is indicated. The Dinacharyokta Anutaila Nasya, or simply what you call Ghrita Manda Nasya is also helpful. Shiro Abhyanga, Shiro Pichu, Shiro Dhara, where there is sleep disturbances, you can go for Shiro Dhara also. Triphala in the form of Rasayana Yoga, Triphala Yashti Madhu with the Madhu and Grita, then Saptamrata Loha, which is a Rasayana for the Indriyas. This type of drugs, this type of medications can be used. Certain specific indications like fever with breathlessness, fever with gut-based symptoms, fever with peripheral neuropathy, fever with thromboembolism. Certain drugs are mentioned here, like Kalamega is getting proven good for thromboembolism and such conditions. Mahatiktaka Yoga, as I said earlier, is said to be very good combination which gives good response. Sitopaladi Churna, Vaidya Bapalal, who was a very renowned physician of Gujarat, in his writing he says that Sitopaladi Churna usually we are giving with honey, but there he mentions that if it is given with Grita, then it becomes a Rasayana Yoga. So probably with this peripheral neuropathy and other things in my mind he has told. In addition to this, if Dashamula with Rasayana Churna means a mixture of Guruchi, Gokshura, that gives wonderful response, or that gives wonderful results in diabetic peripheral neuropathy. Probably it will give good response here also. So such yogas can be used. In the breathlessness management particularly, exercise and breathing exercise, yoga plays a vital role. Controlled breathing is of much help, like closing eyes, one hand on the chest, on stomach, and then slow relaxed breathings to be given. This should be practiced repeatedly in a day. Paced breathing is another thing which is helpful. And these are the different postures for the breathing practice. And exercise. Exercise is, of course, is a good thing to be practiced in post-COVID, particularly respiratory involvement when it is there. And after exercise, if you can speak a sentence pausing once or twice to catch your breath and are moderately to almost severely breathless, then you are exercising at the right level. This is what the observations say. Anyhow, limited or Ardhashaktiya Nishyastu Vyayama, that type of Vyayama or exercise are indicated. Initial days will be a bit difficult. As the day passes, it becomes easier and you can extend the duration also. This is one schedule of Vyayama or exercise which has been presented in many medias. Post-ventilation complications, Vata predominant conditions, Abhigata Janya, such conditions are there, where Vata, Prana, Vayu is very, very important and it has to be addressed, where Vrana Ropana Karma or Vrana drugs indicated internally for Vrana Ropana like Yashti Madhu, Triphala and all, and Marma Abhigata, you have to Marma protection or Marma injury prevention you have to do. Vatanalomana with the Tali Sadichurna and Brishta Eranda. or Gandharva Eranda, Eranda Churna fried or processed with Eranda Thaila, that is good. And Pranayama, of course. In the mental health component, meditation, prayer to boost the confidence, relaxation techniques to ease up the stress, recreations again gives a very much relaxation, counseling, positive counseling is to be given along with Sattva Vajaya. This is all part of Sattva Vajaya Chikitsa, and the picture what you are seeing is the one which is being practiced at our CHC ward, and we do conduct certain activities like yoga, quiz competitions or Damsharad and many things in our CHC ward. And what we have seen is the recovery is faster and positive recovery is seen. Complications are minimum with Ayurveda intervention. The role of Panchakarma, as I said earlier, Tikshna karmas are to be avoided. Nasya, even if you are doing Nasya, then it is better to go for Mrudu Nasya karmas or Dinacharyokta Nasya karmas. In the Purva karma, of course, Abhyanga and Sweda, yes, definitely we can do this. Again, there we have to restrict ourselves to the severity. And Paschat Karma, Samsarjana, diet planning and other things are always advised. However, this is left to the physician's discretion. Conditions like myalgia, yes, Abhyanga is very helpful with a suitable oil. Vatahara oils, generally cheerable and other things can be used. Now coming to another aspect of yoga and pranayama in the principle management, this is of course relaxation and Sattva Vajaya part of it. There is a scheme which has been mentioned by the Yoga Institute for post-COVID management, and personalized pranayamas like Nadi Shuddhi Pranayama, Shitali Sitkari, Bhastrika, Kapalabhati and other things can be practiced or can be advised, limited to the strength of the patient. Or Bala is very important. Here, looking into the Bala, you can advise all these things. Coming to referral indications, yes, if patient is not responding to the treatment what we are giving, patient is entering into hypoxic conditions repeatedly, lung disease, severe lung disease presentations or conditions are there, cardiac complaints like chest pain, repeated chest pain, not responding again to the treatments, and multi-system inflammatory syndrome as in case of children. Of course, in our practice, in our hospital, we have not seen, we have treated more than a couple of our 10, 20 patients of children with the post-COVID infection. And I have come across with only one child with the repeated history of fevers after COVID infection. Of course, the treatment what we are given is Indukanta Ghrita for internal and Deepanabach and other drugs for from our OPD level, and we found good response in that. And this cannot be generalized because Kledajanya, it depends on the Desha, Kala, Ahara and Prakriti also. And geographical seasonal plurality is common in India. Because of that also you can see differences. The medicines which we are using in Delhi or in the northern part of India may not be used in South India, may not be as effective also in South India. Drugs like which are having Swarna Kalpas, Swarna Malini Vasanta, Swarna Makaradhwaja and the such drugs, they also are very wonderful, giving wonderful response in post-COVID things. And there is a study in KGMP, that is King George Medical College, KGMC Lucknow, where Swarna Prashana in children is also said to be prophylaxis preventing the COVID infection in children, as well as in adults. They have given Swarna Yukta Yoga. They have seen good recovery from COVID, as well as post-COVID complications or issues are very less. With this, I would like to end my presentation because more detail about the drug and drug things, Dr. Unni Krishnan will be speaking. We have to remember the general guidelines of wearing mask, washing hands, and maintain distance. Along with that, this is for external safety measures, whereas we have to do internal safety with the Rasayana drugs, Chavanaprasha, Ayush, Kwatha, Guduchi, Ganavati, or Samshamanivati, and Anutaila. With these, we can prevent. A good guideline has been published by Ministry of Ayush for this, which of course all of you can take help of. With these words, I end my presentation, and my sincere thanks to the organizers, PM Warrior, Dr. K.V. Rajagopalan, Dr. Murali and all for giving me an opportunity. And thank you all. I'm open to the questions.
Thank you, sir. Now it's time for the questions. May I request Professor Dr. Murali sir to take over the platform?
Thank you, Dr. Rajagopala, for the presentation. Few questions we have. Most of the symptoms which we address during the COVID situation are continued in post-COVID scenario also. So what should be our difference in approach in addressing the same issues in the post-COVID clinical situation, sir?
It's exactly correct, because post-COVID presentation, see, Kavai Gunya, wherever it is taking place, that Kavai Gunya will continue further. And when it is continuing further, same symptomatology will appear. Only thing what we are not seeing is will be the fever component of it. So based upon the symptoms, you have to plan, you have to take the treatment protocol. Drugs I have listed a lot, and physician has to decide what is available, what is feasible, and to the condition also, and that can be done. The approach will be almost similar. Lakshana dharita chikitsa, it will be more of.
Thank you.
Yes.
Another question is that whether there are drugs which are contraindicated in post-COVID situation.
Yes, indication and contraindication, of course, it depends. Again, see, in post-COVID, if Pitta predominancy is there, Pitta Kara or Pitta Vruddhi Kara drugs are definitely contraindicated. And again, and I'm telling, it is a Yukti, it is a Vaidya who has to decide. If Vata predominant symptoms are there, Vata Kara are not to be given, Vata Hara are to be given. Now, selection of Vata Hara drugs, it depends on the availability, it depends on the geographic conditions, patient's prakriti and other things. As a general listing, yes, as I said in case of Maricha, Maricha is very good. Pipali is very good. It works good in certain conditions, certain presentations of COVID, but we cannot give in Pitta Vruddhi condition. That will be very difficult. So this physician has to decide. There is no set indication, contraindication for COVID specific as far as drugs are concerned.
Thank you.
Yeah.
One of the delegates wants to know your comments on asymptomatic patients and what could be our therapeutic approach in such cases.
Asymptomatic patients will not have any symptoms. So the only thing is prophylaxis measures and Rasayana drugs. You can use general Rasayanas. The guidance, the guideline given by Ministry of Health and Ministry of Ayush is very particular for those. Chyawanprash, use of Nasya. Actually, Nasya, when we are doing, it acts as a barrier for entry of virus. A physiological oil coating will be there, and this prevents the entry of microorganisms to some extent. Plus, medicated oils have added benefits. So, asymptomatic patients, the treatment is Rasayana only. Keep a watch on Agni. This is very important. In Agni Mandya, if you are using Rasayana, Agni Mandya will increase and you will not get the desired results. Agni is very important. Take care of the Agni, Deepana Pachana, and then go give Rasayana drugs.
Thank you. Thank you, Dr. Rajagopala, for the clarification.
Thank you very much. Thank you.
Thank you, sirs. Dr. T.M. Unnikrishnavarya, sir, Chief Medical Officer, Ernakulam Branch Ayurveda Shala, will be doing the next presentation. Sir will be speaking on clinical management of post-COVID syndrome. Sir, please.
Respected Chairperson, Chief Physician Dr. P.M. Warrior sir, CEO Gopalabhata sir, Suprant Murali sir, Editor Murali sir, learned scholars, august audience, and my dear friends and colleagues who are watching this program in the YouTube, Zoom, and other medias. With great privilege, I am standing in front of you, being invited to talk a few words regarding the post-COVID syndrome in the Ayurveda Shala seminar. So already most of the points has been covered by the previous speakers. Still, our experience I will share with you with a simple starting in the fundamentals of COVID and everything. Very few slides only. I will not take much time. You see, 2000 has started with a lot of infectious disease in this world. We have got chikungunya, 2006, 7, 8, 8. Some of the area in India still chikungunya is continuing. Then came the dengue. Dengue is still continuing. Zika, Nipah, all these things. We had an opportunity to treat few chikungunya cases when we myself and my wife, working in Hyderabad branch. There we tried Vishamajorandga tablets with Induganta Kashaya, Amrudotara Kashaya. In most of the cases, and we found it is quite effective also. But post-chikungunya condition, joint pain, inflammatory arthritis symptoms, Amavata symptoms, we treated in HNRC Trikakara with a lot of care, and some cases found to be effective Ayurvedic medicines and hospital treatment also. Dengue fever, the platelet count going down, what can be done? Like that, people used to come and ask. We used to recommend so many medicine. Main medicine was Brahma Rasayanam. And Zika and Nipah, we are not saying treated also. So now that is the situation in this world. A latest infectious disease has come, COVID-19. Next slide. Yes. What is COVID-19? SARS, it is a contagious disease caused by severe acute respiratory syndrome coronavirus. Possible mode of transmission of this SARS coronavirus is physical contact, droplet, airborne, fecal oral route, bloodborne, mother to child, animal to human beings. Duration of infection period 2 to 14 days. And how many days it will last? 5 days to 10 months, the infection virus presentation will be there in your body. Viremia will be there in your body. What is the best diagnostic tool? RT-PCR. If it is positive, virus is present. If it is negative, viral load is 0. Like that is the condition going on in this medical fraternity. What are the main symptoms from the public view? What are the main symptoms we are coming across? Fever, cough, fatigue, shortness of breath, loss of taste, loss of smell, sometimes no symptoms, asymptomatic. And what are the complications usually reported by the medical fraternity? Already discussed: pneumonia, viral sepsis, acute respiratory disease syndrome, kidney failure, cytokine release syndrome, respiratory failure, pulmonary fibrosis, pediatric multi-system inflammatory syndrome, like that it goes. Actually, in which category we can include this COVID-19 coronavirus infection? Ayurveda already stated there are 2 categories we can include it. That is Bheshaja Udvamsajanya rogas and Sankramika rogas. Janabad Udvamsa rogas and Sankramika rogas. Janabad Udvamsa chapter has been mentioned by Charaka Samhita, 3rd Samhita Vimanasthanam, 3rd chapter. In that, a very detailed account has been given by the Acharya. But I am highlighting only very few relevant important points in this context. That Vayu, Jala, Desha, Kala, all the 4 factors get polluted and you get the disease in that locality. Maybe a city, small village, a panchayat, municipality, like that. Vayadinam yad vaigunyam ulpadyade tasya moolam adharmaha. Tanmulam va asat karma, tayor yoni prajnabaradha. Prajnabaradha is the basic cause for the pollution or contamination of the Vayu, Jala, Desha and Kala. Industrial pollution, industrial hazard, and all these things we are reading in the newspaper every day that can be correlated with this concept. So what is the management? He is not giving a separate list of Janapadodhansajanya Vyadhi in detail. But he specifically, Acharya specifically is mentioning about the management line of treatment. The first thing is the Bheshaja. Second is the Panchakarma. Third one is the Rasayana Chikitsa. And fourth one is the following Dhanacharya, Ritucharya, Aharacharya.
चतुष्वपि तु दुष्टेषु कालान्तेषु यदा नराः भेषजेन उपपाद्यन्ते न भवन्त्यातुरास्तदा. He says, if you start using the medicine from the beginning itself, na bhavantyaturaha, you will not become a sick person. That's very important statement. Karma panchavidham tesham bheshajam punaruchyade. If once you get established with a disease or as a preventive measures, you try to neutralize the contaminated toxins in the body. So detoxification process, neutralizing process, that's what our Panchakarma says. That is going to be very, very helpful. Tesham bheshajam paramuchyade. That will be one of the best line of treatment. According to the Charaka, Vamana, Virecha, Vijrejana, Masya, Anuvasanavasti, Kashayavasti. He is not considering Rektamoksha as a Panchakarma. And the third one is Rasayananam Vidhivacha Upayoga Pratishasyade. Various types of Rasayana Prayogas mentioned in the Charaka Samhita can be used, recommended according to each conduct. He is not giving a detail about what type of Rasayana is useful in the Janabada Udvamsa Janya Vyadhi. And the last one, Sadvrittasya Anuvrittishta. Follow a disciplined lifestyle. Dinacharya, Ritucharya, Aharacharya, if you follow strictly, there are chances that you will not get afflicted with the Janabada Udvamsa Janya Vyadhi. Next category is the Sankramika Roga context. Whether corona can be included in the Sankramika Roga or not. Mode of transmission of Sankramika Roga, it is told Prasanga, Gatra, Samsarga, Nishwasa, Sahabhojana, Sahasaya Asana, Vastra, Malya, Anulepa. You see, Prasanga, close physical contact. In the corona context, we are saying the social distancing is very, very important. And the Gatra Samsarga, physical contact should not. Physical contact also get infected with that disease. So nowadays we are using the gloves, PPE kit and all these things. Nishwasa, I should say that breathing, exhale the infected air. That is that should be considered as the meaning of Nishwasa. In that case, we are recommending nowadays use of mask, head shield, etc., etc. Or not only that, it is told Nasamvrta Mukha Kuryat Shuti Hasya Vijrambhanam. Cover your face while you are doing the sneezing, laughing, and coughing and all these things. Saha Bhojana, eating together, sharing the plates, glass, spoons, all these things should be avoided in such type of diseased patient. And Sahashaya Asana, sharing the resting material like chair, beddings. You see, in the hostels and the hotels and community hall and all these places like this, we are sharing the chairs and everything. That also may cause the disease infection. And the Vastra Malya Anilobana. Sorry, Sahasayyasana, sharing the resting material like chair and everything I already told. And using the bathrooms, sharing the bathrooms and toilets also. Vastra Malya Anulepa, using clothings used by another person and sharing the makeup materials, collyrium, etc. So those who are artists, especially acting artists, they share the cosmetic material in between them. Kathakali artists share the dresses in between them. All these things leads to the infection of the from one person to another person. And it is also told in the Manusmriti, Upanahaucha Vasascha Drada Manyirna Dharil Upavitam Alankaram Srajam Karakamevacha Manusmriti. Upanahaucha Vasascha Drada Manyirna Dharil Upavitam Alankaram Srajam Karakamevacha Tejel, he says. In that case, there are chances you get the infection. So what are the contagious diseases? Sankramika rogas, we should say. Is Kushta, Jwara, Shosha, Netrabhishyanda, Aupasargika roga. Kushta, so many infectious skin disorders are contagious. And Jwara, infective bacterial origin and viral origin, we should say, consider in the present scenario. Shosha, most of the post-COVID conditions mimic with the Shosha, Raji Ekshama condition. Peenasam, Shwasam, Kasam, Amsarujam, Murdharujam, Aruji, Vidbransham, Vidshosham, Chardi, etc. So many such symptoms, Rajakshma symptoms are coming in the post-COVID symptoms. Other conditions I am not mentioning. So post-COVID COVID management, we can consider into three categories: prevention, COVID stage, post-COVID syndrome. Government of India in association with Ayush department has come out with so many recommendations. I am proud to say that Ayurveda Shala was also a part of that decision committee making and everything. So they recommended the following medicines: Intukanta Kashayam, Luadi Guliga. Our CMPR people has done an excellent job in doing the research on the Indukantam Kashayam, which is immunomodulator. Viluadi Guliga has got antiviral effect. Then Sudarshanasabam and Brahmarasayanam, Chavanaprasham. Ayurvedishala already done research upon the Brahmarasayana in anti-aging. It is found to be very effective in anti-aging. So it is one of the best medicine as a preventive. Chavanaprasham already so many research has been done and it is found to be immunity modulator, anti-aging, like that. Ashwagandha Churnam. Regarding Ashwagandha, one of the first number one Ayurvedic drug all over the world, not only in India, all over the world. So many research has proved it is an immunoprotective medicine. So Ashwagandha Churna. Ayush Kwadha Churna. Again, CMPR has done an excellent job and found to be very effective found to be immunomodulator effect. Aparajita Dhuma, one group in I think part of central Kerala, Thrissur, and they have done a research in Aparajita Dhuma and found to be the Dhuma found to reduce the presence of pathogenic microorganism in a closed atmosphere. Apart from all these things, Pathya Ahara, lifestyle modification, yoga. Already Dr. S. Rajagopala has in detail explained about the Patyahara and yoga. Then COVID stage, what we have to do, either hospitalized management or home quarantine management. Hospital in very severe cases get admitted in the hospital. Your minor symptoms means home quarantine only. Here I would like to say one few words. In Ernakulam area, so many people in the house itself, they are daily using the paste of ginger, turmeric, garlic with milk every day. They are telling they are not getting infected. 2-3 family people, patient came to me and 4 to 5 member family, one person is not getting the infection. The remaining people has got it. So while questioning them, they are telling where they are very regular in using the ginger, turmeric and garlic paste every day. This has to be researched. We have to work a lot upon this one as a preventive as well as a curative. The person who is not infected taking care of the other people, those who are infected. So that has got some already our physician has mentioned about the effect of PK warriors are mentioned about the effect of ginger paste in a YouTube talk. And post-COVID syndrome, either it can be an outpatient or hospitalized. If the symptoms are very severe, kidney failure, heart and respiratory problems are there, cytokine syndromes are there, the patient has to get admitted in the hospital, there is no doubt. And other cases who reported in our OPD Ernakulam branch, we have made a record of all these things and I am going to present about that one. So what are the anticipated post-COVID complications? It's pulmonary complaints including fibrosis, ILD, liver disorders and anemia, cardiopulmonary ailments, dermatological problems, digestive complaints, musculoskeletal disorders, immune disorder including weight loss, fatigue, psychoneurological issues including insomnia, restlessness and anxiety, recurrent upper respiratory tract infection, general or without any symptoms. In our OPD, Ayurvedishala branch, Ernakulam, along with me, Dr. Anil Kumar and Dr. Kavita also worked. We got nearly 25 cases in our OPD. The work is still continuing. Out of 25, I selected only 19. 6 cases has been omitted due to various reasons. Ayurveda Shala's research committee is prepared a special case history to record the symptomatology and treatment of these post-COVID cases. And we recorded all these things in that case sheet only. And such parameters has been followed. Total number of patients, male 11 patients, female 8 patients. Patients came once their RT-PCR negative, with the RT-PCR negative report only. So the period of the infection for them was 7 to 16 days. They were infected and 17th day only they came negative. 9 cases were hospitalized and 10 cases were undergoing the home quarantine. Age-wise distribution of the patients. 20 to 30 age group, 2 males and 2 females. 31 to 40 age group, 4 males and 2 females. 41 to 50 age group, 1 male and 3 females. 51 to 60 age group, 2 male only. 61 to 70 age group, 1 male, 1 female. 71 to 80 nil. 81 to 90, 1 male only. Symptoms reported by the patients. Before writing the symptoms reported by the patient, we asked them, what are the symptoms you got during the infection? Most of them said, during the infection period, mild to moderate fever, throat pain or throat infection, cough, tiredness or lethargy, headache was the symptoms, no other major symptoms. And the presenting symptom, after once it is came negative, what are the presenting symptoms? Itching reported by 2 patients, poor memory reported by 2 patients, diarrhea 2 patients, runny nose by 2 patients, irritability 3 patients, loss of smell or taste by 4 patients. And again, dyspnea by 4 patients, headache by 5 patients, fever 5 patients, short breath 7 patients, weight loss 8 patients, cough 10 patients. Hello, hello, hello. Yes.
Hello. Yes, we would like to request Dr. TMU sir to continue the session.
Thank you. Sorry for the interruption. So one lady reported with main complaint is a white discharge and low back pain. Another patient, after the COVID infection, he got weakness of his right hand with a severe numbness. Yeah, you're able to hear. Yeah. So next is the treatment. Before going to the treatment, I would like to say a few words. What is actually happening in the virus infection in our body? Coronavirus is an infectious acquired disease. It is inflammatory in nature. Actually, what is the pathophysiology? Already detail has been told. In concise, in very short, I would like to say that coronavirus latch on human cell surface protein, and the protein and the coronavirus spike come in contact with the human cell protein. It works as a lock and key method, and the virus get into the body. Once the virus is inside the body, it might multiplies so fast and it hijacks the function of each and every cell, tissue, and organs. It chiefly affects the endothelial layer protein, angiotensin converting enzyme that previous doctor has already mentioned. It acts with that one and creates the damage in that protein layer. Once inflammation and damage happens in that protein layer inside the artery, veins, capillaries, and the layer spreading to the lungs, pancreas, heart, gut, and all. Some area it affects the epithelial cell also. So once this inflammation and damage in the protein layer happens, it blocks the nutritional and oxygen supply to the particular part of the body, which deteriorate, damage, or disrupt the function of that particular cell, tissue, or organ. That's how the pathophysiology happens. That is why if the potential diabetic patient get affected with the coronavirus, if his pancreas is affected, the pancreas is not functioning properly and the insulin production is disturbed. So blood sugar level become very, very, very high. What is the difference between influenza virus and coronavirus? It is very clear that influenza virus affects mainly the lungs. Coronavirus affects all over the body. It affects the heart, gut, cerebral, nervous system, everything. So we have to see the conditions, even the post-COVID conditions also, from this simple pathophysiology level. Cytokine strong, all these things comes. You can correlate with the rasadhatu dusha, raktadhatu dusha, mamsadhatu dusha, sroto, rota, paka, all these comes. But the basic fundamental pathophysiology is this. In our work, what are the medicines we prescribed? Dashmulla Kadatraya Kashaya, Ela Ganadi Kashaya, Intukandra, Drakshadi Kashaya, Musali Khadiradi Kashaya, Dusparsagadi. Ela Ganadi Kashaya, nobody has mentioned in the previous talk. But I should say that Elagana Kashayam, Ganadi Kashaya is one of the best formula combination for the respiratory tract disease, especially if there is a cytokine. I think so. If we prescribed and we found in so many cases very effective. Drakshadi also in anemia means Drakshadi is the one of the best one. In Lehams, Agastarasayanam, Chavanaprasham, Brahmarasayanam, Talisabatradi, Staveri Gulam. Staveri Gulam has been prescribed to that lady who was suffering from severe white discharge. Vanasurnadi Lehyam, Parushagadi Lehyam, acidity. So many patients used to say the acidity. The Parushagadi has been recommended. Guligas like Guruchanadi, Swasanandam, Surya Prabha, Annabhedi. So Surya Prabha reduce the inflammation so fast. So two times or three times is very, very effective. And Asava Arishta, the Smula Arishta, Vasaga Derishta, Kanagasava, Murdiviga Arishta. We selected very few Asava Arishta because most of the cases there used to be very acidity and all this thing. So recommending the Asava Arishta condition was very, very few cases only. Churnam like Ashugandha Churnam, sea health granules with sugar, without sugar like that also. Ayushkwada Churnam also we recommended. And in the patient who was affected with the numbness and pain in the right hand, we recommended Nahanarayana Daila, another case Sajaradi Daila, Purnava Daila, Pamantaka Daila for the hair fall. Vadagam, Stalisabatradi Vadagam, and Vyoshadi Vadagam. What is our observation? We are still feeling that our treatment are quite effective. But you have to consider that it's a very busy OP. We cannot go into all the such details of each and every patient, so all the system-wise examinations, all these things we cannot go. And we have to see the socio-economic status of the patient also. We cannot write so many examination tests, this thing, CT scan, X-ray, and even say X-ray also, people are not ready today. You won't believe that if we ask them to come for a BPA test, though they are telling you are using the same BPA parts for all the patient. Oximeter, they are not ready. So all these are practical problems we are facing in the OPD level. If we go for a detailed study with the more number of patients in the various Ayurveda branch centers with the strict case history taking and everything, then only we can come out with a specific clear-cut opinion, actually what is our role, where is our role and all. Symptoms of post-COVID condition may be under general categories. Dhatu symptoms are there, Ama symptoms are there, Agnimandya symptoms are there. Specifically asking Rajakshma symptoms, Shwasagasa, Jirna Jora, Ojakshaya, Pandu, all these things are coming. In the single patient itself, we are creating a mixture of symptoms. And patients are not, they did not report properly after 2 weeks or 3 weeks. They keep on continued using the medicine even after 2 weeks and 3 weeks and 1 month. So they are contacted over the phone to get the feedback. So many problems, such problems we faced in our study, but the work is still continuing. Further advice is expected from the scientific committee how we can go and all these things. So that's all. Thank you very much for patient hearing. My humble thanks to the organizers for inviting me to this program. My Sashtang pranams to our managing trustee, Padma Bhushan, Dr. P.K. Warrior sir. Thank you all. If there is any simple questions, I am ready to answer. Murali sir.
Thank you, sir. Now we request Professor Dr. K. Murali sir to moderate the discussion session. We also request Dr. Murali sir to offer his comments and views on the paper presentations and discussion happened on this platform and to sum up the sessions.
One question is that what is the importance of liver health in post-COVID management? Which medicines and drugs have relevance in this regard?
Thank you for the question. Liver affect most of any disease, liver get affected. So we have to consider that liver point. Drakshadi Kashayam, Vashagudichadi Kashayam is the drug of choice in such conditions. Generally, According to this specific condition, we have to go for liver cot and all other Katarohini and all these things.
One of the delegates wants to know more about the initiatives of Ayurveda Shala in the context of COVID prevention and post-COVID management.
Thank you for that question. We are already in the forefront in advising the patients for prevention as well as the post-COVID. All our brands, we have facility for the post-COVID management, and there is Ayush Shield clinics are there in our branches, prescribing the specific medicines for prevention from the COVID. And those who are already affected, they want for post-COVID condition treatment, kindly contact our centers in the various cities of India, or you can contact us through the email, or you can visit our website www.ayurvedashala.com. You will get the email. You can kindly send those who are not able to contact the branch or in person. Kindly do it.
Another question is not so much related to the topic still. People are nowadays apprehensive of taking aristas and asavas, mostly due to the metabolic diseases. Your comments on that?
That's a wrong notion and wrong message has been given by other system of practitioners. It is very wrong. In our practice, Ayurveda Shala has experience also. Nobody has reported with any metabolic or any liver damage with the use of asavas or aristas. We are preparing asavas and aristas according to the Shastra instruction. Naturally generated alcohol is there in that asavas and aristas. According to the government of India's instruction also, 5 to 10% naturally generated alcohol is permitted in each and every asavas arista. That is not going to damage liver or anything. If at all anybody is having any doubt, it is already told in the text that you dilute the asavas arista with water. If it is diluted, a bad effect is, if at all is there, it will be gone.
Thank you, Dr. T. M. Unnikrishnan.
Professor Dr. K. Murali sir will be summing up the sessions.
Respected Dr. P. M. Varia sir, Chief Physician, Ayurveda Shala, Dr. K. Muralidharan, Additional Chief Physician, Ayurveda Shala, our CEO, Dr. Gopalakrishna Pillai, other dignitaries of Ayurveda Shala present here, respected resource persons and dear delegates from far and wide India. So the 57th Ayurveda seminar is coming to a conclusion. Perhaps this may be one of the oldest seminar series in India. And usually the subject is selected in relation to the contemporary health scenario. So this year we had the topic post-COVID syndrome. So many webinars are conducted on the topic COVID, and which is more relevant is, of course, post-COVID syndrome, which is still not defined, and the protocols are still being in a volatile stage. So we have chosen this subject to empower Ayurveda to respond to the current challenge. As far as Kerala is concerned, we are having the emergence of epidemic in every year, such as chikungunya, Beals disease, etc. And we are more or less familiar with the treatment to such epidemics. But this year, we had the pandemic directly coming from Wuhan to Kerala through a medical student. And the spread was in such a speed that all the economic activity and social system of Ayurveda was affected very much, along with India and throughout the universe. So we have to respond to the challenges. The diseases may be changing, but our fundamental principles are still valid in addressing such situations. Acharya Ganadhasan has mentioned that Adrishta Drishta Kaladi Parinamad Anekatha Purana Praviliyande Navena Pradurasyade Vibidhyande Sthidaschatra. Many of the diseases mentioned in classics may be disappearing. Purana Praviliyande, Navina Pradurasade. Newer diseases may be coming up. Vibhidyante Sthidaschatra. The pattern of manifestation of prevalent diseases may also change. And for these, what can be the reasons? Adrishtam. The reasons cannot be found out very much easily. Then kalam can be considered as another cause. Kaladushti, which can be considered as the climatic changes due to environmental pollution, etc. So these are well envisaged by our acharyas. So what we have to do is interpret the disease according to their doshic pattern. Anuktamavi doshanam linger vyadhim upacharet, as depicted by Acharya Susruta. So same is explained by Vagbhada also. Tasmat vikara pragatir adhishtanandarani cha buddhva hedu visheshamscha shikram kuryat ubakramam. Vikara prakriti means the nature of emerging diseases. Adhishtanandarani, the sthana samsraya or the organ of the body affected by the disease. Bhutva hedu visheshanscha, particularities in the causative factors. So considering these three, we have to formulate a particular therapeutic protocol to address the emerging diseases also. So this approach is nothing new to Ayurveda. So Ayurveda very well equipped in principle to address such diseases. And this seminar is intended to empower Ayurvedic fraternity in the war against COVID. We have chosen the resource persons in such a way that the different perspectives of post-COVID syndrome is highlighted in the seminar. Dr. Aravind is the head of infectious disease department, which is not existing in all the medical colleges, but Medical College Thiruvananthapuram is spearheading the war against COVID, and he is very much included in different committees and policy making bodies by government of Kerala. So he is well in touch with the scenario. So his presentation was very much informative. Actually, he started with the terminologies related with post-COVID syndrome. So there are several terminologies postulated: post-COVID syndrome, long COVID, ongoing COVID syndrome, such as so many in our science also, these approaches actually envisages different perspective of the health situation. In our Ayurveda also, we have different synonyms for one and same clinical entities. Rajayakshma, Shesh, Shosho, Rogaraj, Idija Smritaha. So different perspective of a particular clinical entity is highlighted by each of the synonym. Similarly, different terminologies are also suggested for this clinical situation. Another point highlighted by Dr. Aravind was the multi-system involvement. Ashesha Kaya Prasiddhan, Asheshan, as put forth in the opening sloka of Ashtanga Hridaya. All the systems are affected with this post-COVID syndrome. And actually this Sannipata, symptomatology of Sannipata Jwara, so many verses are devoted for the explaining the clinical features of Sannipata Jwara. And it starts from the feet, Padayo Suptada, and ends in the Murtha, symptoms manifested in the Shiras or head. So that also represents the multi-system involvement of this post-COVID syndrome. And immune dysregulation was another point highlighted by Dr. Aravind, that also represents our synonyms to Sannivada Chikitsa, Ojo Vibhramshaka Jwara, Sannivadam Abhinyasam. So this concept of Ojas is also involved in the Samprapti or pathogenesis of Sannivada Jwara. Extra pulmonary complications are also highlighted by him, the pathology, pathophysiology, and the postulated mechanism. Still, the pathogenesis is not well explained. What are the postulations in the pathology is also narrated by him. He also incorporates the various researchers going on different part of the globe. And he added his experiences at Medical College Thiruvananthapuram also. So this opening paper was actually very much introductory to this subject. And it was an easy opening for the other speakers to narrate the Ayurvedic approach also. Dr. Mukesh, the young scientist from VPSV Ayurveda College, Kottakkal, explained the post-COVID syndrome in terms of different clinical stages of Jwara, Jirna Jwara, Punaravartaka Jwara, and Vaigalyada Jwara, Bhavet Vaigalyadobisa. So that is also a reference related to the Sannivada Chikitsa. And he interpreted the term Vaigalyata to organ damage. That is also something new information, new interpretation to us. And the importance of Jwara, which we consider as a model treatment approach for all the diseases. Jwara Prathana Roganam. So the treatment of Jwara is considered as a model to all the treatment for different diseases. And this was also highlighted by Dr. Mukesh. And actually, Gananathan also used this approach. He correlates pneumonia with Shosanaka Jwaram, and many of the diseases pertaining to respiratory system and other systems are also well correlated with Jwara and Jwara Chikitsa. That also highlighted by Dr. Mukesh. He stressed the need of incorporating the Chikitsa of different diseases, Shwasa Chikitsa, Shopha Chikitsa, Hridroga Chikitsa, Pandu Kamala Chikitsa, and Vadavyathi Chikitsa, according to the different manifestations in the post-COVID syndrome. He also emphasized the standalone treatment and add-on treatments. In some situations, we have to add our therapies with the conventional or modern treatment system. And in some cases, which may be moderate or mild in clinical assessment, we can have our own therapies. So that approach is also very much important, where we can do the standalone treatment and where we can do the add-on therapies. So that approach, I think, is very much important, especially when we have any chances to integrate the different systems of medicines. Bheshaja Kshipija Chikitsa can have a preventive role in post-COVID syndrome, especially after the recovery from COVID. If we adhere to this Bheshaja Kshipija Chikitsa, which is mentioned in Roganulpadaniya chapter of Ashtangardaya Sutrasthana, Bheshaja Kshipide Pathyamahare Brahmanam Kramad. So this same approach is reflected in Punaravartaka Chikitsa also. So that approach can be considered as a preventive nature, preventive therapy in post-COVID syndrome also. So after the recovery from COVID, we can do this Bheshaja Kshipija Chikitsa, that also suggested by Dr. Mukesh. Dr. Rajagopala, as a representative from All India Institute of Ayurveda, the institute that spearheads the COVID management in India. So he narrated his field experiences, supported by the theoretical background, was also very much contributory to this seminar. And actually, he started in continuation with what the earlier speakers concluded, explaining the current scientific perspective of post-COVID syndrome. He moved to the principles of Anukta Vyadhi Chikitsa. He also highlighted the theory of Srodasas. Actually, all the diseases are directly or indirectly related to the Srododushti, the synonym Dukkham. Sukham is the synonym of health or Arogya, and Dukkham is the synonym of disease. There the Dukkham is interpreted as Dushtam Kham. Dushtam means vitiated, and Kham is synonymous to Srodas. So every diseases in a way is actually the manifestation of Srododushti. So he highlighted the Srododushti in relation with post-COVID syndrome also. And he has classified the primary and secondary Srododushtis occurring in post-COVID syndrome. The post-COVID protocol issued by Ayush Ministry also very well explained by him. Actually, this institute is contributed much to the formulation of protocol by Ayush Ministry, and what can be done individual level and what is to be done in community level are also well explained in this protocol. Sthanam, Dosham, Avastha. These are the 3 points highlighted by him, Dr. Rajagopala. The Sthanam or Sthana Samsrayam, where the Samprapti or vitiated dosha resides, is important. Dosham, which dosha is predominant in the manifestation of a post-COVID syndrome in a particular disease. Avastha, Mridu, Madhyam, Darinam, or Ramam, Niramam. So there are so many Vyadhyavastas. Actually, in the first chapter of Ashtangardaya itself, Acharya says, Kshanadar Vyadhyavasta cha Kalo Bheshaja Yogakrit. Vyadhyavasta, the clinical stage of a disease, is very much important in choosing the therapy. So these three, dosham, sthanam, avastha, that we have to consider while assessing each and every post-COVID cases. Vyadhi kshinada and bheshaja kshinada, that also stressed by him. Many of the patients may be debilitated by the effect of Vyadhi itself. So Vyadhi Karshita. So there are some references, Durbala Vyadhi Karshitan. So Vyadhi Karshanam or Vyadhi Kshinada is an important factor to be considered while assessing the post-COVID syndrome. And Bheshaja Kshinada, especially the modern medicaments, may be affecting the ojas of the diseases. The older Vaidyas are considering most of the allopathic drugs are too much Ushnavirya and affecting the ojas also. So these two has to be considered. What are the factors related to Vyadhi Kshinada and Bheshaja Kshinada? This has to be considered, and that also has to be addressed while choosing the treatment. He also correlated the post-COVID syndrome with Sannivada Koba and classified the disease as Kaphavada predominant and the Pitta Rekta predominant. List of medicines also included in many of his slides, and we can choose so many medicaments from that list instead of limiting or pinpointing to some medicines according to the physician's choice. He has limited the medicines in as a list. So according to the dosha and sthana, we can choose from the list. And here we also very much appreciate the richness of Ayurvedic armaments in the fight against COVID from the list of medicines itself. He could incorporate the opinions of several scholars, and successful yogas were also especially highlighted by him. So that was very much contributory to our information regarding the treatment approaches in post-COVID syndrome. Another addition by him, Dr. Rajagopala, is the simple pranayamas and exercises. While stressing upon exercises, he especially pointed out that it should be in Artha Shakti. Artha Shaktiya Nishayvyastu, Velibi Sniktha Bhojipihi. So that will be an addition to the multi-pronged approach towards the treatment of post-COVID syndrome. And in conclusion, he especially pointed out the referral indications or challenges in relation with the post-COVID syndrome. So we should understand the limitations of our medicines when we have to refer the patient to a tertiary center where life supportive systems are available. That also we should be, Ayurvedic patients should be very much aware of. So from the Ayurveda Shala side, we had the resource person, Dr. T.M. Unnikrishnan. He also had a rich experience as a chief medical officer at Ayurveda Shala branch in Ernakulam. He explained the post-COVID syndrome in the light of Janavadodhvam Seniyam. The Charaka, Acharya Charaka has devoted a complete chapter on epidemics in terms of Janapadodhvamsaniyam. He also suggested some inputs from Dinajarya and Rudujarya and Avasargika Rogas, Sangramandi Naral Naram. Avasargika Rogas also explained by him. He also listed the prevention of the COVID disease and what can be done in COVID stage and what should be done in post-COVID syndrome were also explained. The common knowledge, we may term it as folk knowledge or anything else. The use of ginger and turmeric as a kalka was the people's knowledge or people's understanding or people's management in prevention of COVID. That also we have to consider. Acharya mentions that Uttayana Shenam Mecha Striyo Nechandi Taltyachir, or Charaga also highlights the importance of collecting the knowledge from common people. That also is very much important. In Garbhini Charya, Bhagpada says that we have to collect the do's and don'ts about Garbhini from older women. So the common people has also have some knowledge that we have to collect, and we may have to interpret it scientifically in terms of Ayurveda and incorporate to our armament. Even though the sample size of COVID cases are very less, actually it was a cross section of the ongoing process of documentation of post-COVID management by Ayurveda Shala, and several branches of Ayurveda, several outlets of Ayurveda by Ayurveda Shala is now equipped with the COVID, post-COVID syndrome management, and all these are well documented by our research team, and we hope that we could come out with a very very polished formulation for post-COVID management. And as a conclusion, I say that I have to conclude that the seminar, I think, opened the arenas of research that can be done in post-COVID syndrome. And I think it boosted the confidence of those delegates in the management of post-COVID syndrome. It also exposed the strength and weakness of Ayurveda. The limitations of Ayurveda was also explained by the experts, along with the strength where we can have our strength in the management was also explained. Anyway, the documentation is the need of the hour, and I think the Ayurvedic fraternity will be inspired in documenting all the COVID and post-COVID syndromes after this seminar. With this conclusion, let me thank all the organizers and resource persons and the delegates. Thank you.
And endowments which Ayurvedishala Institute every year for meritorious students. May I request our Honorable Chief Physician, Dr. P.M. Varya sir, to please come to the stage for presenting the prizes. Sir, please. First, Ayurvedian P. Madhava Warrior Memorial Gold Medal, instituted in memory of late Dr. P.M. Warrior, our first Managing Trustee and Chief Physician. It is awarded to Ayurveda PG scholar from Kerala University of Health Sciences, who performs the best at the technical presentation competition. This year, the gold medal goes to Dr. M.D. Aroma, PG scholar from MVR Ayurveda Medical College, Parashne-Kadavu. Unfortunately, Dr. M.D. Aroma is not present here for some personal inconveniences. And the consolation prize goes to Dr. C. Sajat From VPSV Ayurveda College, Kottakkal, Department of Manovijnana Evam Manasaroga, PG Scholar. Dr. Sajad, please come forward to receive the certificate and cash prize. Next, Ayurvedic S. Warrior Memorial Endowment Prize, awarded to the best outgoing student of VPSV Ayurveda College. This endowment has been instituted in memory of late Ayurvedic S. Warrior, who was the Chief Physician and Chief Medical Officer of Ayurvedishala for many years. This year, this endowment prize goes to Dr. Jairam KV from VPSV Ayurveda College. Dr. Jairam, please come forward to receive the certificate and cash prize.
Next comes the presentation of the Jnana Jyoti Award instituted to honor Srimati Malati and late M.K. Devidas Warrior for the best outgoing female graduate from Vaidyaratnam P.S. Warrior Ayurveda College. This prize goes to Dr. Vaishnavi PM, VPSV Ayurveda College, Kottakkal. We request Dr. Vaishnavi to receive the certificate of merit and prize money of rupees 15,000 from Dr. P.A. Warrior. Now, we shall move on to the distribution of different scholarships for the children of Ayurvedishala employees. First one is the AVS Chandramani Anjaria Scholarship. This year it is secured by Ms. Vani K., daughter of Jayarajan PV, QA Department, Ayurvedishala. She is also secured the Sardar Jagjit Singh Chadda and Sardarni Manmohan Kaur Chadda Endowment Scholarship. And there is also another student who is secured the Sardar Jagjit Singh Chadda and Sardarni Manmohan Kaur Chadda Endowment Scholarship. We request Ms. Atira Sridharan, daughter of Sridharan, HO Factory, to receive the endowment.
Raja Rani Memorial Scholarship for this year goes to Ms. Ranjima M., daughter of Radha Krishnan, AH and RC Kottakkal. The Bhagavan Das and Krishna Devi endowment for this year goes to Ms. Drishya S., daughter of Shivan BV, Powerhouse, Ayurvedishala. So the presentation of awards and endowments end here. Now, may I request our additional Chief Physician and Trust Board member, Dr. K. Muralidharan, sir, to propose the vote of thanks for the event.
Good morning, everybody. Respected Dr. P.K. Warrior, sir, our Managing Trustee. I know that he will be in front of the screen watching all these things. It is why I'm addressing him at the first stage. Our respected CEO, sir, Gopalapalla, sir, Chief Physician, Dr. P.M. Warrior, sir, senior colleagues, Dr. T.S. Muralidharan, Mr. Rajendran, Ramesh, Madhavangutti, and respected doctors. We are at the closing point of the scientific session. Before entering into the duty assigned to me, let me speak a few words on this auspicious occasion. We believe that Ayurveda Shala has a genetic legacy inherited from our founder, Vaidyaratnam P.S. Warrior. In fact, even this platform is an explicit expression of the genetic legacy we have. Our founder envisaged Ayurveda Shala to be a functional center for learning, teaching, practicing, propagating, and popularizing Ayurveda. We believe that by the grace of Almighty, under the governorship of Dr. P.K. Warrior sir, we are running on the right track. The visions and voices presented over here today by eminent doctors are thought-provoking ones. It really helped to have a better insight of the topic discussed here. I would like to change the topic post-COVID syndrome. No, ongoing COVID syndrome. That was the word used by the speaker initially. So we need a correction. It's an ongoing COVID syndrome. All the 4 invited speakers are eminent personalities in the field of medicine and are well known for having proven their mettle in their own domains. It is indeed a privilege and prestige for Ayurveda Shala for having them, for all of them brought together to this platform to make presentations. They have done their job extremely well. Aspects of the management of ongoing COVID syndrome. I would like to take this opportunity to thank all of them on behalf of Ayurveda Shala. Dr. Aravind sir, you actually took us to a different world and showing us the advancements of the modern medicine, how keen they are to deal with this particular situation. It was very informative, enlightening, thought-provoking. Then Dr. Rajagopalan sir, Dr. Mugesh sir. Mugesh sir gave us a lot of information. He was talking about ferritin, referring to coagulopathy. It is something very new information, at least for me. Similarly, Dr. Rajagopalan sir, he was talking about the theory, practice, and everything. And also he was making some side comments. He was talking about Sidopaladi Churnam with ghee is a good rasayana. That was shared. It was a side comment. Of course, it's very useful to all of us. Similarly, my colleague, Dr. T.M. Unnikrishnan. Dr. Unnikrishnan was taking us back to basics for some time. Then he came to the contemporary situation. It was a nice approach. Thank you, Dr. Unnikrishnan. Now I thank Dr. Aravind sir, Dr. Rajagopalan sir, Dr. Mugesh sir, and also T.M. Unnikrishnan on behalf of Ayurveda Shala. Our chief editor, Dr. K. Murali sir, who played a pivotal role in shaping up this hybrid webinar, and also played the role of a moderator, well-balanced moderator. I should give him an adjective. He was a well-balanced moderator so effectively. Thank you, Murali sir. We believe that you are an asset to our institution. I would like to thank the award winners and their companions for the presence and participation on this occasion. The audience joined on this platform made our venture a great success. We run short of words to thank you all. Ayurveda Shala sincerely express heartfelt gratitude to the media persons for sparing time to attend the function during their busy schedule. Dutch, the event management group, set up a wonderful platform for the event and coordinated the program so well. We appreciate your efforts and wish you good luck. I don't want to take much of your time. I know it's time for lunch. Let me conclude my talk expressing thanks to everyone associated with this function. Thank you all once again.
Thank you, sir. This year's